Morning, everyone, and thanks for joining us today on Earth Day, the 22nd of April. I'm Emma Mulligan, for those that don't know us, and I really appreciate you all joining us today. For those that have registered but perhaps aren't able to join live on the day, the full day will be recorded and sent out post-event. So if you're having to dip in or dip out today, we're grateful to have you for any part that you're able to join us, but you will receive the full recording at the end of the day. Because this is free and open to all, please feel free when the recording link comes out to share with any of your colleagues, friends or family members that may find it of interest. All of our events here at the BSLM are currently aimed at healthcare professionals or those working within the health and care sector. So most of our content is facing the healthcare professional, but we do hope to be able to add some patient-facing content soon as our charity grows. So thank you so much for joining us. I think the main reason that we decided to hold today's event is that whilst planetary health isn't a specific one of the 6 pillars necessarily, our environment and the built environment is really important and plays a role and kind of underpins everything that the other 6 pillars represent. So we're very conscious of the legacy we're going to be leaving behind for our future generation. We touch on planetary health in various times throughout our content, but this is the first time we've put on a specific Planetary Health Day. And I'm really proud to say that that's introduced and hosted today by our Planetary Health Special Interest Group. So BSLM hold special interest groups to really focus on best practice and creating resources for those that are experts or really passionate about certain areas. And those can be found on our website under the special interest groups tab, which is under education. You can have a look at what other special interest groups exist, and you can see who makes up those teams. Where possible, we always try and get real multidisciplinary focus. So anything from physios to nurses to dentists to doctors to surgeons, all sorts of different disciplines, because it really does take a full team to get lifestyle medicine fully embed throughout our healthcare systems. So thanks to our Planetary Health SIG for driving that. Just some housekeeping. As I mentioned, we hope that you can fully submerge yourself in today, but we know that can be difficult when you've got full day jobs, especially for those that perhaps were off for the long weekend or have got kids home for the holidays. So as I mentioned, the recording will be available. We'll send you a link, but it'll also be hosted on our website. There's a chat. I can see people introducing themselves, and it's always wonderful to see some of our regular names coming through there, but also to see some nice people that perhaps aren't members or are new to the BSLM. So welcome to those. You can use the chat, as I said, to introduce yourself, but please use the Q&A function for questions and answers. It should be at the bottom of your screen. The chat can get busy with comments and feedback and introductions. So please do make sure you use the Q&A function so that your questions don't get lost. We put some breaks throughout the day, a bigger gap over lunch and then 2 breaks. Whilst these are hopefully to be able to get you to hydrate and move around. It's a very sunny day here in Scotland. So hopefully you'll get some nice time outside, but also throughout the day. It's a recording. You can walk and talk, pop it on your earphones, or get out there in nature while you're listening, if that's possible. And then at the end of the day, we will have a feedback link that comes through. Please use this to rate today's event, but also there's an opportunity to just tell us a little bit more about what type of events you'd like us to cover, what topics may be important for you, and then we'll start putting those together. We do a monthly webinar series on the 3rd Tuesday of every month, and that covers various different topics, so we can use your insight for that as well. But we also hold longer study days such as this. Some of those are free, some of those are for members only, and then others are open to all but are paid events. And it really depends on the makeup and the content that we're putting forward. This one, of course, we felt was really important. We want planetary health to get to everyone. And so please, as I mentioned, feel free to share that far and wide. That's it from me. If there's any questions, we will be keeping an eye on the chat. And over to Matt and Maria from our Planetary Health as our Planetary Health chairs. Thank you, Matt, for hosting today.
That was absolutely wonderful, absolutely spot on, beautiful, brilliant, and fantastic. Thank you very much. And it is a joy and a delight to see so many people here today. I'm going to see if I can. Jamie, do you mind if I just share my my screen? We will just change where we are. So my name is Matt Sawyer. I will introduce myself and Maria at the end rather than the beginning. I know that sounds like a bit of an odd way around to do things, but really it's to think about why are we here today. And I just want to give you a little bit of background about World Earth Day before we start talking about how lifestyle medicine can save the planet. So Earth Day is an annual event. It occurs April 22nd every year, and it's really there to demonstrate support for environmental protection. Believe it or not, it has actually been going on since 1970. It now has a wide range of events that are coordinated globally. I will put the link in of earthday.org, and it now involves about 1 billion people in 193 different countries. This year is the 55th anniversary of Earth Day, and there are people around the globe who are going to be participating, demonstrating that we have got the long-standing power of Earth Day to bring people together and work together for a better future. And it's really been important that grassroots people power has always been at the heart of Earth Day. And it's this that's the catalyst for the shifting change, because when we as individuals unite with a common purpose, we can overcome some of the most entrenched systems and industries. And actually, what sort of actions are included on World Earth Day? Well, it can be anything from plastics to clean energy to restoring plants and animals, reducing deforestation, looking at food and food systems. In fact, a lot of what lifestyle medicine is about, and a lot of what today is about. And to paraphrase slightly, remember, helping the earth isn't just for one day, but for life. So what's today all about? Well, today is really about demonstrating that link between personal health, patient health, population health, and planetary health. And there's really a great series of speakers and topics lined up today, from plant-based eating to greener healthcare, one conversation at a time, to the environment and how it can improve brain health, to therapeutic gardening, to knowing what actions we can take to make general practice greener, to looking beyond and thinking about some of the benefits of forestry and being outside, and looking at things from an energy, food, climate change and health overlap. We've then got some physiotherapy recommendations, and then looking at the medical consequences of climate change if we don't do things a bit better than we are at the moment. So that's a bit about today globally and a bit about today ourselves. And I'm just going to pop into the chat the link to World Earth Day, so you can see that you are part of a much, much, much bigger picture. And actually, I'm now going to think about, well, how can lifestyle medicine save the planet? We know that it is really important. We know that the health and well-being and livelihoods of all humankind are dependent upon nature. And yet, nature is under more threat than ever. In the UK, the State of Nature report in 2023 showed that the United Kingdom was one of the most nature-depleted countries in the world, with declines in insects and flowers and plants and animals. Globally, we know, for example, that almost all rivers tested are found to have pharmaceutical pollution. However, we also know that there are physical and health benefits of being part of a natural living world. Green spaces benefit health through minimising exposure to harmful substances, such as air pollution or excessive heat, improves stress management, improves mental well-being, enhances physical activity opportunities, reduces diseases and mortality such as cardiovascular disease, and through exposure to things like natural sunlight, daylight, improves sleep. Is there anything a planetary health approach to lifestyle medicine can't do? And if we look after and restore the natural living world looks after us. Just before I start, I'm going to make a reminder that the British Society of Lifestyle Medicine annual medical conference is taking place this September in Brighton. Well worth a visit. The tickets are available at the moment, and I'm quite sure that in the chat will be posted a link of where to get these from. So, lifestyle medicine and the planet. How can it save the planet? Well, 4.5 billion years ago, when the Earth was formed, the average temperature on this planet was around 80 degrees centigrade. About 600 million years ago was the last ancient ice age. Also called the Cryogenian period, this was when it was known as Snowball Earth. During this time, ice covered large swathes of the planet, with glaciers blanketing huge expanses of the northern hemisphere and ice present even in the equatorial regions. NASA has calculated the average temperature of this period was closer to -10 degrees centigrade. The planet has been through far worse. However, we as mankind have not. And this really emphasises that it is not the planet which is in danger, it is us. We, as humans, are in danger from climate crisis and ecological collapse. What would an environmentally sustainable future mean to healthcare? Well, the Cambridge Dictionary defines sustainability as the quality of being able to continue over a period of time. For humankind to continue, we need to live within our planet's means. To continue to live, thrive and survive as a species, we need to take a step back from breaching planetary boundaries. Planetary boundaries are really this framework to describe the limits and the impacts of what human activities are doing on the Earth's system. For example, we cannot continue to take more resources from the natural living world than it can replace. We cannot continue to deplete the ozone layer quicker than it's able to repair itself. We cannot continue to acidify the oceans or continue to pollute the air, soil or earth faster than it's able to repair itself. Simultaneously, a safe space for humanity is desired, with access to the things that we all would want: good quality food and nutrition, clean water to drink, clean air to breathe. Alongside that are fulfilling employment and adequate income, with peace and justice, social equity, gender equality, good quality sustainable housing, suitable housing and plentiful clean energy. I suspect that we could look across the globe at the moment to know that there is a shortfall in that social foundation for humanity for many people. So we're trying to get this balance between not causing environmental, ecological harm, simultaneously trying to improve or increase that social foundation globally. Well, how are we doing? Well, actually, the problem at the moment, or one of the problems that we're facing, is that we are overshooting these planetary environmental boundaries. We can see even over the last 15 years or so that as we are assessing and monitoring and measuring the impact in different in different sectors, we are starting to cross boundaries. So back in 2009, we had crossed 3 of these planetary boundaries. A couple of years ago, when this was last repeated, we had crossed half a dozen of them. Collectively, we are moving towards an irreversible collapse. And there are interactions across these areas of the natural living world. Whether it's the soil beneath our feet or the blue waters of the oceans, There are a myriad of codependencies which are essential for our very survival. And we ignore the evolutionary process that have occurred over millennia to have produced the balanced living world that we've seen around us at our peril. So we can really start to see that there are more planetary boundaries being crossed over the last 15 years or so. And just to give a bit of an idea about what these planetary boundaries look like, we have got one which is ocean acidification or ozone layer depletion. Well, actually, we're doing okay with these at the moment. They are not breaching their boundaries. We may remember that we turn the clock back to the 80s when we had more hairspray than we knew what to do with, that we were damaging the ozone layer because of the gases that were within the propellants within the aerosols. And actually, globally, we did something about it. We said we are not, as a planet, going to keep using these gases. The ozone layer is repairing itself. There are others, such as climate change or integrity of the biosphere or freshwater change, where actually we are causing more harm and we are taking more stuff, more fresh water, for example, than is able to be replaced. One of the most important is climate change. But what does climate change really mean? Well, it's recognised that climate change poses the most profound threat to the health of the nations of the planet. There are many aspects of environmental harm that are occurring, but the one which contains every single other issue is climate change. And climate crisis is not just about the rising concentration of some invisible gases in the atmosphere that we can't see, we can't taste, we can't smell, but it's the effect on the social foundation of humanity that's important. Whether it's extreme weather events affecting housing or infrastructure or food yields from farming, the climate crisis has physical and mental health impacts and an increased risk of death. It affects our access to the clean water we need to drink or clean air that we need to breathe. Sarah Birch was one of the lead authors on the latest Intergovernmental Panel on Climate Change report, and she said, "We cannot reach our broader sustainability goals. We cannot reach our broader sustainability development goals of a vibrant nature, clean water, no poverty, and healthy communities if we don't address climate change." This is something which I think that most of the audience, if not everybody, will recognise and identify. The 6 pillars of lifestyle medicine. But how many would see this as a solution to all those problems I've just mentioned? The links between lifestyle medicine and planetary health have not always been well identified. So the 6 pillars, just as a recap, we have got mental well-being with teaching proven techniques to reduce stress and to help people with relaxation and mental health. We help to find purpose in life and improve health through connections with nature. We have physical activity. Lifestyle medicine helps to support people to choose the ways in which they can incorporate more physical activity into their lives, as well as reducing time spent sitting down. Just as an aside, I'm at a standing desk at the moment. I'm stood up for all of this. It means that I get to move more, and I would encourage anybody and everybody listening to this to stand up and listen to this whilst moving around. Healthy eating is another pillar. Lifestyle medicine supports people to reduce the consumption of ultra-processed food by teaching the knowledge and the skills required to follow healthy eating patterns of a person's own choosing. We have sleep. Lifestyle medicine supports people to achieve good quality of sleep and to avoid the behaviours which can impair sleep quality. We have healthy relationships, supporting people to develop and sustain healthy and meaningful relationships and increase social connection to reduce stress and improve both mental and physical health. And finally, minimising harmful substances. So lifestyle medicine is there to help people minimise those harmful substances, whether it be smoking, alcohol, addictive substances, or behaviours such as gambling or excessive internet or social media use. Now, it might just be that I'm going to expand on some of these as we go, but I will highlight some of the links and the benefits and some of the ways that lifestyle medicine can help save, if not the planet, then at least humankind. One very important aspect and element of sustainable healthcare, and that link and that crossover between lifestyle medicine and planetary health, is considering the 4 elements of sustainable healthcare. So this is a diagram from the excellent Centre for Sustainable Healthcare, and this really highlights that there are 4 principles to achieve sustainable healthcare. The first, and I think by far the most important, is prevention. If we can prevent if we can promote health and prevent disease through a whole host of different methods, actually healthcare can become more sustainable. We're not treating people that didn't need to get that disease in the first place. Second is about patient self-care, about empowering people to take a greater role in the management of their own health and healthcare conditions. Thirdly is about streamlining care systems through a lean service delivery to reduce waste. And fourthly, about low carbon alternatives. Can we treat this disease or this condition with a treatment method which has got less environmental harm, a lower environmental impact? And where does lifestyle medicine help? Well, it helps all of them. Oops. So what I'm going to ask first of all is a question about prevention. So this was some research done by The Lancet, and they asked the question, what proportion of dementia is avoidable? So in the UK at the moment, we have nearly 1 million people who live with dementia. Nearly 1 in 10, nearly 10% of the over 65-year-olds have dementia. But what proportion is preventable, and how could lifestyle medicine fit into this? So I've given you the answer. Is it, but I'm going to ask you the question, is it 0.5%, 5%, 25%, or 45%? What proportion of dementia could we have avoided? Well, actually, the answer is 45%. So if I had a drug that could reduce the risk of dementia by nearly 50%, would you take it? Would you recommend other people to take it? I think that the answer would be absolutely yes. The report in The Lancet last year found that the potential for preventing dementia is high, and nearly half of all dementias could be prevented by eliminating 14 risk factors. It is never too early and never too late to take action, and even those who've got an increased genetic risk of dementia, the risk factors can be modified. Okay, so sustainable healthcare says let's try and prevent things if we can from a planetary health. Can we do something about it? Well, what are the 14 risk factors? Well, these were the 14 listed in The Lancet. But where does lifestyle medicine fit in? Well, actually, it could fit in with depression, well, and physical exercise, of course. That's one of the main pillars. Well, air pollution, well, that's a harmful substance. So if we could avoid people's contact with a harmful substance, that would be really important. Well, alcohol's a harmful substance as well, and smoking, of course. So that's a lifestyle medicine thing that we could do something about. Well, social isolation, well, we've already mentioned the importance of good relationships. And then, of course, we've got things like high blood pressure, diabetes and obesity, which have all got aspects that fall under lifestyle medicine. So actually, lifestyle medicine has got the ability to influence and have an impact on more than half of the modifiable risk factors for dementia. So if we could use lifestyle medicine, we can do things from a more environmentally sustainable approach, prevent disease activity, and actually this turns out to be good for many reasons. Well, patients and families, of course. Imagine only 500,000 people having dementia rather than 1 million? What would the impact be on their family members, on the rest of society, on staff time and on patient demand? Well, if we only need half as many memory clinics, half as much medication for dementia, that sounds like it would be a reduction in the amount of staff needing to be caring for patients with dementia. It has an impact on treatments, financially and from a planetary health perspective. So we can start to see that lifestyle medicine can prevent some of the most cruel diseases around. Actually, we've mentioned on here at least 3 different harmful substances. We've got smoking, we've got alcohol, and I've brought air pollution into this as well. Harmful substances, from my perspective, are more than just tobacco, alcohol, recreational drugs, gambling, internet use. We can start to see on the planetary boundaries diagram, or from the diagram, that there is a sector called chemical pollution. And actually, these are harmful substances. So within this chemical pollution sector are what's known as man-made novel entities, things that humans have made that are being released into the natural living world. And these can include things like pesticides or pharmaceuticals, antibiotics, plastics, heavy metals, radiation, and things known as forever chemicals. We already know some of these names. We've heard of the pesticide DDT. I have mentioned CFC propellants, which were damaging the ozone layer. We've had lead in petrol. We had radioactive radium paint. There are a whole host of others, such as endocrine disrupting chemicals, polychlorinated biphenyls, per and polyfluoroalkyl substances. And actually, we've already heard of some of the real-life examples of how polluting the natural world has direct human health consequences. Whether in Bhopal in India in 1984, with a leak at the Union Carbide pesticide plant, which released 40 tonnes of a deadly gas from a storage tank. More than 20,000 people were killed and hundreds of thousands were injured. Over the years, survivors were twice as likely to die from cancer or lung disease or tuberculosis. Or more recently, Flint in Michigan in America, 2014. The water system pumped untreated, lead-contaminated river water into the taps, exposing 100,000 residents, including up to 12,000 children, to unsafe levels of lead. And we know that lead, as a harmful substance, is a neurotoxin that can impair intelligence. This is why we took lead out of water, why we took lead out of paint. But this is not just historic events. Air pollution today is one of the leading causes of premature deaths globally. And around 8 million premature deaths each year, of 8 million premature deaths each year, 80% are directly attributed to the burning of fossil fuels. So what can we start to do about this sort of thing? Well, I'll come on to these posters in a moment, but one of the things that I was really pleased that the British Society of Lifestyle Medicine is promoting and trying to get involved in is to stop the development of undeveloped oil and gas fields. If we know that burning fossil fuels creates harmful substances and we are exposing people to that, and to the extent that we are causing millions of premature deaths each year, it is beholden upon us, now we know this, to do something about it. Another impact of climate change is heat and heat waves. And in the UK, we had the heat wave 2 years back, where temperatures got to 40, 41 degrees. And I know that we've got people here today from all parts of the world. 41 degrees may not sound a lot, but if you're from the UK, it certainly is a lot. And for those of you who are in Scotland, it's really, really, really hot. But actually, we know that the heat waves, which are a direct consequence of a change in climate, affect those who are most vulnerable and put them most at risk. And this can include those with, for example, underlying mental health problems. So recent research has shown an increase in the incidence of suicide with rising temperatures, or an increase in hospital attendances and admissions during heat waves. So what can we do about it? Well, one of the things that the special interest group is doing at the moment is creating infographics, which were on the last slide and on this one, really with a view to helping members of the public, patients, professionals to understand the links between planetary health and human health, and the actions that we can take from a lifestyle medicine perspective to actually make improvements. And this is an example of the heat and mental health one, which we are working on at the moment. Another pillar of lifestyle medicine is about healthy eating. Well, when it comes to the diet and what we eat, there are some important elements which are contributing to a worsening climate crisis. So livestock, for example, contributes about 15% of global greenhouse gas emissions. At the same time, we know that high processed meat diets are linked to health problems within humans. So a solution to this is to increase the amount of fruit and veg consumed on a daily basis. This not only reduces the risk of health conditions such as heart attacks, strokes, some cancers, but it also reduces our impact on the natural living world, reduces the amount of greenhouse gases that are emitted. But we have to be aware that the current baseline in the UK is only about 1 in 3 adults and 1 in 10 children are consuming that 5 a day. And to make it even trickier from a lifestyle medicine perspective, how do we implement this across all parts of society when 1/5 of people were finding it difficult to manage financially? Well, again, one of the things that we are working on at the moment are infographics such as eating patterns in heat waves. So this is there to try and help people manage a bit better, and taking into consideration that increasing the amount of fruit and veg, reducing the amount of processed meat, and being able to do it on a budget is really, really important. Again, from a lifestyle medicine perspective, we know the benefits to an individual of being physically active. But we may not appreciate that there are co-benefits for our colleagues, our communities, and the planet of being more active as well. Take, for example, the daily commute to our workplaces. To have a more active commute is great for that individual. We know that that lowers the risk of physical problems, and people are less likely to be admitted to hospital if they have an active commute. In addition, 80% say that their mental health improves. Well, that sounds a pretty good return on investment. Even better, from a business perspective, 60% of people say that they have an increased productivity as a result of their commute. Well, we want a more productive healthcare system, and I think that active commuting has a real role to play in this, and actually for very little or virtually zero financial cost. But of course it gets better than that. Active commuting reduces air pollution, improves air quality from less burning of fossil fuels. So the community benefits from less exposure to harmful substances, and less greenhouse gas emissions. The planet benefits as well. And if we get it right, if we get a lifestyle medicine approach from a planetary health perspective, we can start to see some dramatic results. So a study was done looking at 8,000 people who were helped to do more green activities and to take part in them, such as nature walks, community gardening, tree planting, wild swimming. And this was really a review of the largest such project in the world. The results showed that after taking part in these schemes, people's feelings of happiness and of life being worthwhile improved. Levels of anxiety fell significantly. The project also found the financial cost of a green prescription was about £500 on average, making it very cost effective when compared to other treatments. So, for example, cognitive behavioural therapy costs about £1,000 for 10 sessions. Importantly, it reached a broad range of people. So 21% of them were from ethnic minority populations, 57% from economically deprived areas. Overall, it makes green prescriptions, green activities make life more worthwhile. That sounds a pretty good definition of being healthy to me. And I'm going to talk about one particular example, which is linking together physical activity, improving mental health, and social cohesion and making relationships. And this is the Wild Swim project. So this is a medication way of creating good physical and mental health. It forms bonds between humans and the natural living world. It links with each other for a support network and through a shared common experience. Increasing life satisfaction by 25%. For me, that says just about it all. What about another pillar of lifestyle medicine? Sleep. But we also now have eco-anxiety. We know that eco-anxiety is associated with depression, anxiety, stress, insomnia, worsening mental health, functional impairment, and a reluctancy to have children. More common if you're in a climate concerned population, if you're female, if you're in a poorer country, or one of the younger generation. New Scientist reported that the climate change means that people are losing sleep, hours of sleep every year. And we know that the lifestyle medicine approach to sleep is really important, really sensible. Maintaining the same wake and sleep time each day, having a dark, cool, quiet bedroom, avoiding caffeine and alcohol consumption, spending some time in the natural light to get a dose of melatonin to sleep well and to keep active. But actually, what does that mean from an eco-anxiety perspective? Again, our special interest group is putting together some infographics on how to sleep better with eco-anxiety. So climate anxiety is rife, and part of that is with uncertainty. What is going to happen next? But taking actions might help you feel in control. Talking with others, joining forces, making lifestyle changes based upon your values. Validating concerns. I hear you. I know that you're worried. I sense that you're angry about this issue. Directing efforts through advocacy groups, finding which organisations to get involved with. Educating ourselves on the steps that we can take to minimise our impact on the environment, and doing something positive can really, really help. The book on referenced on the left is called Active Hope. And this very much says this is about doing something active, because that in turn reduces our eco-anxiety. So whether it's spending time in nature with your family, planting flowers, planting trees, it can be really, really positive. We have an ask of everybody today, everybody who listens to this. And that is, on World Earth Day, we would like each of you to make a pledge, to do one thing differently. Whether for you, for your family, for your colleagues, your workplace, your patients, your community, I want you to write your pledge down and tell somebody what you're going to do and why you're going to do it. Whether that be on social media, whether that be pinning it to the fridge, it doesn't matter. But let somebody else know what the action is and why it's important to you. Well, what sort of pledge might it be? It might be to show an understanding of the links between planetary health, population health, and personal health. It might be to recognise that the lifestyle medicine approach can improve all of these simultaneously. And it's knowing that the things that we do collectively can make a real, real difference. When pledging, I always mention 50 shades of green. We don't have to be an all or nothing, a black or white, a one end of the spectrum or the other, a naught or 100. But actually, we just need to do something a bit greener, a bit better today than we did yesterday. Our pledge might be on most days. On most days, I will actively commute to work. It might be when I can. When I'm not picking up the kids from school, I will walk to work. It could be when the sun shines. It's really important to not make ourselves feel guilty and say, but I've missed a day of doing this thing, therefore it's all my fault. It's getting out of that mindset. It's doing as much as we can when we're able to do so. So that is the most important thing, is to make a pledge. So from all of the speakers today, I want people to pick up top tips, top things that they can do that fit into their work life or their home life, and to make a pledge and to tell somebody about that pledge. And finally, I'm going to introduce ourselves. I'm going to stop sharing in just a second, and I'm going to introduce Maria. So I'm Matt Sawyer. I work for myself at Sea Sustainability. I am part of the Planetary Health Special Interest Group. I was a GP for nearly 20 years. And it is a privilege and an honour to both be co-chairing today and to be co-chair of the Special Interest Group. So if I stop sharing, hopefully, Maria is there as well.
Hi, good morning to everyone, and thank you very much for coming. It's great to see everybody here, and thank you, Matt, for that fantastic presentation. That really summed it up. It was really fantastic. We've had a few questions, some of which I have dealt with, but one that's coming through is, are the infographics available yet? And if not, when will they be available, please?
Yeah, so this is our work that's in progress at the moment. We are hoping to have a whole suite of them available for the British Society of Lifestyle Medicine conference in Brighton in September. And the plan is to have them across all of the pillars of lifestyle medicine and the different pillars of planetary boundaries and planetary health. So it's showing the interest and overlap. If people want to get involved in helping them, in helping to write them, helping to check them, we would be absolutely delighted. Myself and Maria will both put our email addresses in the chat in due course. But yeah, we are here to take your expertise from the people who are here at the moment, who know probably a lot more, who have got expertise that myself and Maria don't have. So in the near future, over the next few months, but it won't be absolutely by the end of today.
Yeah. And a nice mention there from Rob Lawson about, what is donut economics? It's a very good question. And I think really in lifestyle medicine, we're really promoting that regenerative, distributive economy, and hoping that everybody, our patients and us, that we thrive, and that's not just about sort of economic growth. It's about redistribution and closing the inequality gaps. Thanks for mentioning that, Rob.
Yeah, donut economics is fantastic, and it is well worth. If you just Google donut economics, there is a single diagram which is basically explains that we are living on a donut. We neither want to exceed our planetary boundaries, our environmental boundaries, but nor do we want to fall down the hole in the middle and have a society that doesn't have its needs met. It's how do we get that balance so that we can do both? Is it possible? Absolutely, and donut economics really is a great descriptor, and there's some very short videos on it which are well worth watching.
I think that was all the questions and comments so far, at least. Thank you.
Fantastic.
Keep
Well,
them coming.
we are both here all day, so we will be able to answer them in the as we go. And I'll have a look through and see if there's any other comments in the chat as well. I hope that we can hand over to our next speaker of the day. Is Alicia there?
Yeah, all good. Thanks, Matt.
Over to you.
Welcome to the Planetary Health Study Day. I am Alicia Walpase, qualified registered nutritionist with a master in nutrition and certified lifestyle medicine professional. I am the founder of Health by Nutrition, and through personalized diet, I help people become healthier, stronger, and less dependent on medication. The Planetary Health Diet, introduced in 2019 by the Eat Lancet Commission, is a global reference diet designed to promote human health and environmental sustainability. This diet is adaptable to individual dietary needs, personal preferences, and cultural traditions, allowing for flexibility while maintaining its health and sustainability goals. If you are here, it means that you care about health, and you may already know that food is perfect medicine. The research is clear that foods like vegetables, fruits, healthy proteins, fiber gives us longer and better lives, and a poor quality diet often leads to disease and early death. But is that all? The thing is that the same foods that are harming our health are just harmful to our planet. Our food system, the things we do to farm, transport, package our food are a leading cause of environmental changes. They are responsible for up to 30% of the world's greenhouse gas emission and 70% of the fresh water we use. Different foods have differing impacts on the environment. As shown on the graph, the production of animal-based foods tend to have higher greenhouse emissions, shown on the orange bars, than producing plant-based foods, and dairy also, and red meat, especially beef, as you can see. Beyond emissions, it's also important to note that food production places an enormous demand upon our natural resources, as agriculture is a major contributor to deforestation, species extinction, freshwater depletion, and contamination. We can see here the green bars, land in use, and water consumption in blue bars. On the graph on the left shows the greenhouse gas emissions produced by the average diet, especially those high in meat and dairy. So we call it an average diet. These animal-based foods are responsible for a large share of emissions due to factors like land use, feed productions, and methane from livestock. So where we can start to improve? We can start from using a plant milk. You can see on the graph on the right that any of the plant milks will be much better in terms of the greenhouses production, land use, and water use in terms of cow's milk. But if we all switch today to a plant-based diet, we could draw down the equivalent of 16 years worth of fossil fuel emissions with the land released. And that emissions from the global food system alone would make it possible to limit the global warming to 1.5 degrees Celsius. 40% of adults have at least one chronic condition, and 16% of children. We are spending more on healthcare, social care, welfare support for those suffering from chronic related disease than it would cost to fix our diet. Non-optimal intake of free dietary factors, such as whole grains, fruits, sodium, accounted for more than 50% of deaths and 66% of disability-adjusted life years attributable to diet. The latest Lancet cut-down states that this number is now 12.2 million deaths globally every year. How much does shifting to a plant-forward sustainable diet help? When people swap just 3% of their daily calories from meat to plant sources protein, the effect is remarkable. In a study where people swapped out unprocessed meat for plant protein, there was a 12% lower death rate. And swapping out processed meat resulted in 34% lower death rate. That's a huge benefit for just a 3% swap. If you eat around 2,000 calories a day, changing just 60 calories from meat to plant would be equivalent to changing your diet for life. And look at the land use in the UK. We could release 75% of farmland if we were to all adopt a plant-based diet. And farm animals consume 5 times more food than the entire human population. And across this vast area, farm animals that are entirely pasture-fed produce just 1% of the world's protein. In the UK, 22% of land is grazed by sheep, yet only produce 1% of our food. This is 23 times the area we use to grow fruits and vegetables. Yet, if we transition to a plant-based diet food system, we would free up to 75% of farmland that could be used to restore biodiversity and capture carbon. More than 70% of animal foods in the UK came from animals raised in factory farms. And we are facing a growing global health crisis. Antibiotic resistance. In 2021 alone, 1.14 million deaths were directly caused by bacterial antimicrobial resistance. Why is this happening? A major driver is industrial animal farming. 70% of the world's antibiotics are used in livestock, not people. What are the consequences? Here we have 12 leading causes of death globally, and also more deaths than in HIV and malaria. If we limit meat to 40 grams a day, we would reduce antibiotic use by 66%. We are in this pandemic risk again, where 3 in 4 of world's new or emerging infectious disease come from animals, responsible for 3 million deaths a year. And what about air pollution? Cardiovascular problems, respiratory disease risk. We all breathe the gases which are in our air. Animal agriculture is responsible for 80% of deaths from pollution related to food production. What if we change? Every day you make dozens of decisions about what to eat. Those decisions determine what's on your plate for 3 meals every day, and that adds up to more than 1,000 meals a year. Even if you make environmentally friendly choices for just some of those meals, you will make an enormous impact on your own health and the health of the planet. And if you live with others and influence their food choices, your impact can be even greater. For example, if you shop or cook for 3 other people in your household, your impact jumps to almost 4,400 meals a year. What is a healthy and sustainable diet? It is a plant-based diet, predominantly plant-based diet. If we eat more than 80% of plants, is developed by the Eat Lancet Commission. It aims to feed 10 billion people sustainably by 2050, and is estimated to save 11 million premature deaths per year. This planetary health diet It's combined of fruits and vegetables, which are your half plate. So it's a majority of fruits and vegetables. Remember your colors, remember your rainbow. Whole grains, they are very important because of because of the fiber, and they are also your energy source. Plant proteins containing beans, lentils, nuts, and they are like 2-in-1. So they contain proteins and also fiber. Unsaturated oils protect your heart health, and the options are like olive oil, nuts, especially walnuts. Animal foods, they are here. You can see them on the right side of the plate. They are in red. They are still there. Then moderate amounts. We want to reduce as much as possible the red meat. And there's also low added sugars, limit for your health benefits. As you can see, there are all options on this plate. That's why this diet is sustainable. And if we will ask a question, what's the most important health question to ask about our diet? Will it provide protection against heart disease and cancer? These are the top 2 killers of men and women around the globe. The good news is that a diet focused around or exclusively on whole plant food is associated with the lowest risk of both heart disease and cancer. The same cannot be said for any other diet patterns. So before you recommend any other diet patterns, you ask whether this diet has decades of scientific evidence supporting the prevention and potential reversal of chronic disease. If the answer is no, then it's not worth the risk. In addition to cardiovascular disease and cancer, there is a global pandemic of overweight and obesity and type 2 diabetes. These chronic conditions together are contributing to the rising burden of dementia. We are also increasingly spending more than a decade in ill health before we die. So you can see here, there are some examples of plant-based diets in clinical guidelines. And a Mediterranean diet, together with a DASH diet, which is dietary approaches to stop hypertension. It's proven to lower blood pressure, support weight loss and cholesterol, promote balance in nutrition, low in sodium, high potassium, calcium, and magnesium. American Cancer Society, in their guidelines for diet and physical activity for the cancer prevention, includes a variety of vegetables and to eat the rainbow, focus on antioxidants, focus on dark greens, red and orange colors, as well as fiber. Thinking about legumes here. So all based on plant-based diet. And we also have the recommendation for diabetes that's to consume minimally processed plant foods, focusing on whole grains, vegetables, whole fruits, legumes, nuts, seeds, and non-hydrogenated oils. UK guidelines is to understand that the food the most damaging to our health are those with the highest emission, pollution, land, and water use. In fact, in some in countries in high income, and not only UK, but also US, life expectancy has started to slow and slowly decline for the first time in the history. So we are all thinking about the big question of what to do, where to shift. We would like to recommend more plant-based foods to protect our environment and our health. We could start to limit the consumption of animal products. And we know that British Dietetics Association confirms that well-planned vegan diet can support healthy living in people of all ages. The blue zones in Ikaria, Greece, Loma Linda, Costa Rica, Okinawa, Japan, and Sardinia, they all focus on plant-based diet. It is recommended to have a half cup up to a cup of beans a day, to limit eggs to no more than 3 a week, focus on the sugar, not to consume more than 7 of teaspoons daily, reduce dairy products, thinking of nuts, healthy fats included in the diet, and very important to include a raw, uncooked product produced in our diet a day. Now I want to compare and to see a non-vegetarians versus vegans in terms of the body mass index and type 2 diabetes ratio. It is important to see those graphs because we can see different diet patterns starting from non-vegetarian, semi-vegetarian, pesca-vegetarian, lacto-vegetarians in vegans. In terms of the body mass index, people who eat less meat, they tend to have a healthier body mass index. And a similar pattern we can see in terms of the type 2 diabetes ratio. The EPIC study, which helps us to focus on understanding the cholesterol, we can see that meat eaters stayed much higher in terms of higher cholesterol, and vegans are containing much less cholesterol in the blood. 25% reduction in heart disease risk for vegans. UK Biobank study is the risk of cancer in regular or low meat eaters and fish and vegetarians. So we want to compare here, and the results are that people who are vegetarians, they have 14% drops in the prognosis of cancer. Vegetarian woman's 18% drop in breast cancer, and vegetarian men's 31% dropped in prostate cancer. Here is a table to present different diseases, starting from coronary heart disease, type 2 diabetes, total cancer risk, stroke, renal failure, fatty liver, Parkinson's disease, and all-cause mortality. We can see that the healthy plant-based diet lowered the risk of all. Of course, there are some potential drawbacks and challenges when we thinking of transitioning to a plant-based diet. The biggest challenge, it's always a nutrition absorption. So people are worried if they will have deficiencies, and people are worried about iron, vitamin B12, omega-3. So thinking about vitamin B12, it needs to be supplement. If we are talking about iron, we need to focus on foods which are higher in iron and omega-3 fatty acids. There are some agricultural transition challenges. The mitigation, it can be that we will slowly adapt sustainable farming practices and diversity crops. And there's also the resistance to change. So we need to go slowly. The gradual changes emphasizing benefits for health and sustainability. We don't want to change from one day to another, as it can be very difficult. So the action to take is thinking more about your favorite meals and swap the produce. You can join the 21 plant-based challenge on the website of plant-based health professionals in UK, when you can be guided how to introduce more plants to your diet and learn more about the benefits. I would like to move to some questions which can be asked related to a plant-based diet. Can a plant-based diet provide all essential nutrients? Yes. A well plant-based diet can provide all essential nutrients. However, attention is needed for vitamin B12, iron, omega-3, calcium, iodine, and vitamin D. How do you ensure you are getting enough protein? You need to focus on having legumes in our diet, tofu, tempeh, whole grains like quinoa, amaranth, oats, brown rice, buckwheat. We need to include nuts and seeds in our meals like chia, hemp, almond, peanut butter. If we combine all different sources throughout the day, we will provide all essential amino acids. What are good sources of iron, calcium, omega-3, vitamin B12? For iron, adding lentils, chickpeas, tofu, pumpkin seeds, and spinach. Remember to add to your meals vitamin C to help the absorption of the plant iron. Calcium, fortified plant milks, tofu, tahini, sesame seeds, paste, almonds, and leafy greens. Omega-3s, flax seeds, chia seeds, hemp seeds, walnuts, algae oil, and we can take also in a supplements form. Vitamin B12. There is no food in plants which is high in vitamin B12. Vitamin B12 need to be supplemented. There are also some foods which are fortified with it, like nutritional yeast and some plant milks. Is supplementation necessary? Yes, for vitamin B12. For vitamin D, the same as the carnivore diet. Sometimes there is an omega-3 supplementation and iodine. Is a plant-based diet safe for children, pregnant women, and older adults? It can be safe across all ages if we plan well. Nutritional needs must be carefully monitored for protein, iron, calcium, B12, and omega-3, and especially during pregnancy and childhood. Could dietary changes interfere with current medication? In some cases, yes. Significant drop in blood sugar level may require adjusting to medication, the diabetes medication. And a blood sugar medication might need reviewing as the blood pressure improves. Food high in vitamin K, like leafy greens, but this person really needs to eat a lot of leafy greens like kale, clavo negro, may affect warfarin doses, so it needs to be checked with the doctors. How should medication dosage like insulin be adjusted if someone's diet drastically change? As insulin sensitivity improves, dosage may be reduced to avoid hypoglycemia. This always need to be monitored with being under supervision. Yeah. So it's really important to speak to your patients when they start to change the diet. They need to be in touch. Is there a risk of disordered eating or undernutrition in patients going plant-based? Yes, it's possible if people start to focus on kind of clean eating and they start to cut too many different foods, they can develop orthorexia or other disorders. It's very important to talk about 30 plants a week, if not, starting off adding plants to their diet, talking about priority, which finally ends up to feeding our gut microbiome, talking about the different plants and their impact. How does a plant-based diet affect cholesterol levels or inflammation? A plant-based diet typically lower the LDL, so the bad cholesterol, and reduce systemic inflammation. Both are very beneficial for cardiovascular health, as I mentioned before. Can people maintain a healthy weight or a muscle mass on plant-based diet? Yes, and adequate calories and protein will help to maintain or even build the muscles, and there are so many athletes thriving on plant-based diet. We need to think about more protein-based products like legumes, soy, whole grains, and healthy fats. Does this diet provide enough calories for energy? Like for athletes, yes. We probably need larger portions and more frequent meals, so we need to get more snacks. And including energy-dense foods like nuts, seeds, avocados, dry fruits, and helps to meet these energy requirements. How can someone transition gradually to a plant-based diet without feeling overwhelmed? So it's important to start with 1 to plant-based meals per day. Maybe trying meatless Monday, focusing on adding more whole plant foods rather than cutting everything immediately, joining the 21 challenge on plant-based health professionals. What are realistic tips for patients who aren't ready to go for plant-based? Is a flexitarian is an option. Encouraging small, consistent changes, recommending plant-based versions for family meals, like, for example, lentil bolognese or veggie stir fry with tofu, and oat-based breakfast with colorful fruits in the bowl. How do you navigate social settings or eating out while staying plant-based? I will always recommend to look at the menus in advance, the restaurant place I'm gonna go, and politely request a modification. There are so many options in different places we eat out. You can ask no cheese, ask for maybe extra veg. You can bring to dish when you go to meet a family or friends, share your ideas. And also being a flexible, like plant-based is not perfect. It's not a one-off approach. We are flexible. We are just eating predominantly plants, but it's a adaptable way of living. There are also some swaps, which are great to make at the beginning. So swapping milk, swapping means for tinned lentils or soy or corn. Crisp, something crunchy like lightly salted or salted nuts, biscuits for maybe rice cakes or corn cakes with peanut butter banana. You can also make delicious oat cakes at home, white rice for brown rice to add in more fiber, and the same for a bread. And this presentation only highlighted the immense power of a plant-based eating pattern, not only to prevent chronic conditions, but to halt their progression and to reverse them in some cases. If I didn't answer your question in the question answer, please send me an email. I'm happy to answer yours. And just to mention that the benefits of a plant predominant diet have made it into most national and international guidelines for prevention of chronic illness. This includes the American College of Cardiology's 2019 guidelines on prevention of cardiovascular disease, the World Cancer Research Guidelines on cancer prevention, and the American College of Lifestyle Medicine position state on type 2 diabetes. So thank you so much for listening to me, and have good the rest of your day. Thank you so much.
That was absolutely fantastic. Unfortunately, Alicia's not with us today, but she has given or offered us to be able to contact her later. I'm just going to pick up a couple of questions. One, the 21-day plant-based diet challenge. I put that the link to that in the chat for Patrick and for everybody. Second, Preeta has asked a question which I'm going to let Alicia answer most of it, but has said one of the there's a big push from the meat and dairy industry to discredit plant foods and confuse consumers by grouping all processed foods together. I find many people interested in climate change and sustainability are ignorant about their impact their food choices have. How best do you suggest addressing this challenge with patients and colleagues? I'm going to let Alicia answer most of that, but I'm just going to highlight that on the plant-based 21-day challenge is a diagram saying why do people sign up? And actually most people are not signing up because of environmental reasons. They're doing it because they want to improve their health and well-being. They want to improve their diet. They want to lose weight. They want to have disease management. So for me, it would be, how do we get people interested? We talk about the things that they're interested in. If they're interested in improving health and well-being, let's mention the plant-based diet. If they're interested in weight loss and fitness, let's mention a plant-based diet. If they're interested in nutritional knowledge, let's mention a plant-based diet. So actually, we may not need to even mention climate change or sustainability. We can sometimes just say, this solves the problem that you're asking a question about. This solves the thing about improving your diet or about disease management. We can actually find a way to help people change their behaviours without necessarily by helping them to solve their own problem. And on that, it is going to give me great pleasure to introduce Dr. Caroline Gibson, who is going to give us an inspiring chat about or talk about greener healthcare one conversation at a time. Over to you, Caroline.
Hello, and thank you for having me here on Earth Day to talk about how we can practically use lifestyle medicine and coaching strategies together to implement greener healthcare in practice. My name is Dr. Caroline Gibson. I am a GP. I'm a mum of 3. I have 3 cats. I love being outside, walking and biking in the County Durham countryside where I live. My professional life is pretty varied at the moment. My main role is that I'm a GP with an extended role in lifestyle medicine, and I am also a certified registered health coach and a qualified coaching supervisor. All of this brings together my combination of interests in lifestyle medicine and coaching, and I use these together to make a real difference to the people that I work with. And today's session, I'm going to think about how we can practically use these strategies together. We know from all the other speakers who are going to speak today and that lifestyle medicine and greener approaches are a perfect complementary fit together. So many lifestyle medicine interventions encourage ways of being that are also greener, whether that is increasing physical activity by using more active transport, moving towards a whole food plant-based diet, deprescribing, and so many more things that we're going to hear about during today. But one of the problems is that quite often we learn the facts, we learn the information, and as a coach, one of the most common questions I get asked is, how do you actually do it in practice? How can I fit this into my busy working life? And that's why I'm here today to talk about what that practically looks like in the consulting room. And over the 10 years I've been a coach and lifestyle medic, I've developed a framework which is a combination of evidence-based behaviour change science, lifestyle medicine and coaching approaches together. And I'm going to outline that framework today. The first step is listening. This is all about listening to your patients. We use a coaching approach to listen to help you really get in touch with what matters to the person that you're working with. In consultations, this looks like active listening, which involves having open body language, avoiding interruption, avoiding distractions, being interested in what the person you're working with is saying. But it also looks like listening for what's going on underneath all this. What is really important to your patient? What are their values? What is their motivation? Now, we all think that we're quite good at this because we do get taught communication skills during training, all the way from medical school or university onwards. But evidence tells us that we're not quite as good as we like to think we are. So every year they do an annual GP patient survey that explores patients' experiences of healthcare. Now, this is purely for GPs, but it is similar across the board in all specialities and all healthcare professionals. Nearly half of patients tell us that they're not as involved in their care as they would like to be. And that's been really static over many years. Now, the eagle-eyed of you will notice here that this graph only goes up to 2019 because they changed how they present the results after that. But the more recent results are not much better. So there was some slight improvement over the last 4 or 5 years, but the most recent results in 2024, which are recently released, show that only 60% of patients report being as involved as they want to be. So that's 4 out of 10 patients aren't feeling listened to and aren't feeling involved. So there's still quite a lot of work to do here. And this is absolutely understandable. We are all so busy in our working lives. We're pushed for time. And when patients come in with symptoms, they start telling us their story, and then we just automatically start thinking about it. What are they telling us? What is the differential diagnosis here? What red flags do I need to think about? Oh, and it sounds like it might be this. What treatment do I need to give? Oh, has the pathway changed recently? Oh, and isn't there a medicine shortage for that? Now, we're all dedicated professionals. We just want to do the best for our patients. So as soon as our patients start talking, we start thinking. Now, the problem is that when we're busy thinking, it stops us from doing really good quality listening. So we need to stop. We need to catch ourselves when we do this, when we've spiraled and got all tied up in our heads. We need to really deeply listen to what the person in front of us is saying. And a simple tactic here is just to set off on the right foot with this. Maybe tomorrow in your clinics, try changing how you start your consultation. Instead of, how can I help you today? Or what's wrong with you? Ask an open-ended question. What would you like from your appointment today? What matters most to you about your health? The next step in this framework is identify. Well, we need to start with identifying where the person is right now and being realistic about where people actually are. So raising their awareness and noticing what is really happening is very important. Once you know where you are now, then you can move on and think about, where do you want to be? What is it that you are looking to achieve? Now, then we start thinking about goals, and we're all used to SMART goals. We've all heard of that. And SMART stands for specific, measurable, achievable, realistic, and time-bound. But I suggest change that M from measurable to meaningful, because it's not very motivating for most people to think about numbers, reducing their HbA1c or their blood pressure. What is going to be a meaningful goal to that person? Maybe it might be having a planet that is going to be healthy for their grandchildren to live in. But even that might be too vague. So absolutely, it's good for a high level value-driven goal, but we also need to be specific and set smaller goals that people can pinpoint the changes that they need to make in regards to their nutrition, physical activity, sleep, and the other pillars of lifestyle medicine. So they have specific actions to work towards. And people might have a goal in mind when they come to you, but people are always at different stages of readiness to change. And from a professional point of view, identifying how ready they are for change is really important. Now, the reality is that many patients aren't ready for change, and that's okay. As professionals, when we learn about lifestyle medicine and greener practice, we get really, really enthusiastic about it. And we want everyone to make all these positive changes because we know it's going to be massively effective and impactful for them. But I offer to you here that actually trying to persuade people is not an efficient use of time. If people are not ready to make those changes, a different approach is needed. It's okay to just offer the information and then leave it there if they're not ready to engage. So we know from behaviour change science that people need to hear messages multiple times to shift them from pre-contemplation to contemplation. And the science from the Making Every Contact scheme says that people need to hear messages on average about 6 times before it moves them forward in their change cycle. So what we do is different depending on how ready for change people are. Now, once we've got people who have identified goals and are ready to change, our next step is to identify the gap between where you are now and where you want to be. And once you've got that, then you need to find a path to take you there. And that path will be different for everybody. But this looks like goal setting collaboratively with the person you're working with, co-creating achievable, sustainable health goals. Now, you're all looking at me thinking, oh my goodness, she's been talking for nearly 9 minutes already. We don't have time for this in our consultations. So I totally get that. So let's be realistic. Let's do what is possible and let's share that with our patients. Acknowledge that our time as GPs and particularly is really limited, so we can agree a shared plan with the people that we're working with, set specific short-term goals, bring them back for review appointments, maybe give them post-it prescriptions on small bits of paper to have something tangible to take away. And it's about finding small realistic changes that are possible. So, for example, instead of prescribing a very generic plant-based diet, help people to find plant-based meal options that suit their culture, their budget, and their preferences. And let's acknowledge that change is not easy. Moving along to doing a new way of doing things, it's all about change and learning and discovering that new way of doing things. It is moving people out of their comfort zone into something that is new and different for them. And we can apply learning theory for this. Any change involves learning and development. And Vygotsky's learning theory talks about moving people out of their comfort zone, which is where they are now, in the areas that they're used to doing and they are they can do at the moment, moving them into somewhere new, something that they aren't able to do at present. So by definition, this is moving people out of their comfort zone. And it's not easy. It is by definition uncomfortable. That's not necessarily easy for us as healthcare professionals. We want to fix things. We want to make things better. We want people to feel better. But let's recognise that growth happens and development happens when people move out of their comfort zone. So we have to allow people to be a little bit uncomfortable. And there is so much for people to learn and do. So breaking things down into the small, realistic, manageable steps is essential. And it absolutely takes bravery for people to make changes and move out of their comfort zones. And to find that bravery, patients and people we're working with need to feel empowered. So that is step 4. Step 4 is all about empowerment. This is all about creating a positive mindset and supporting our self-efficacy in our patients. In modern life, we're surrounded by information and images of the ideal of people out there who are already doing things and who are taking that next step and are already successful. So it's really easy for people to compare themselves and feel disempowered. But people don't have to do it all on their own. They don't have to reinvent the wheel. So educating people on the specifics, the why, the how, the what of making changes is really empowering. Now, each patient's path will be very individual, very specific to them, but at the same time, they can benefit from the experience of others and the evidence-based expertise that we have. So our role as professionals is to provide information for the stage that they're at. If people are still very early on, just helping them with some understanding may be really empowering. So, for example, helping people understand how reducing processed meat consumption can benefit both their health and the environment. And it's encouraging self-management in small, sustainable steps. And offering empathy, acknowledging the difficulties. Many people might need more support with this, and when we're pushed for time, our team is absolutely vital. In primary care, we have the personalised care roles, which have been around since 2020. And this is a combination of our health and wellbeing coaches, our social prescribers, our link workers, our care coordinators, and these people are worth their weight in gold. They have the time and the skills to really get to know people and to support behaviour change. So my takeaway action about empowerment is use your team to support people to be able to make those changes. And the next step is for people to put those changes into action, to move forward, because action is what creates results. Now, moving forward does not have to be perfect, but it does have to start. So we can leverage our coaching techniques to enhance that motivation and increase patient activation. So things like positive reinforcement, appreciative inquiry. So finding out what is working, how can people do more of that? What's worked in the past? What can you learn from that and apply now? And being non-judgmental. Every small movement forward is brilliant and a positive step, regardless of how small it is. So this might look like lots of different things. So, for example, a patient who wants to walk or cycle to work, but is finding that it is just too big an ask for them. So what is possible instead? So maybe they could start using public transport instead. So that would be beneficial both for their health and their carbon footprint, and it's a step in the right direction. So I often ask people that I'm working with, what is one small step that you can do today to create that momentum? And once people are starting to make changes and moving forward, we have to keep going. We have to encourage that progress. One way to do that is to make sure that we're doing something that patients are engaging with and that is enjoyable for them, because if they enjoy it, then they are much more likely to do it. And as they are making these changes, this is where people start coming into barriers and access and problems. There's so many barriers to people for making changes for both lifestyle medicine and greener practice. And it might be lack of access to community support, it might be lack of community facilities, all of the social and economic factors that we know about. It might be the food environment that they live in, lack of access to affordable or convenient access to fresh produce. So all of these things. So one of the roles that I think that's important for us as professionals is to help people find ways of overcoming these barriers and making things easy, making things enjoyable. And this all links into positive psychology, which is based on the work of Martin Seligman. Because if we can find things that are easy for people, and what's easy for people will be different for everybody, but encourage people to lean into their strengths, to find solutions that work for them, that they are good at. If somebody enjoys cooking, encourage them to explore new recipes, for example. And Seligman also talks about having positive relationships and engaging people with similar interests, and how powerful that is to support people to make progress, to increase their well-being. And having that support around people in the community and in their relationships gives them people for who they can share ideas with, collaborate, shared resources, and also benefit from accountability to keep people on track. You put all of those things together, it helps people to really have some positive progress, which is reinforces it in themselves. So simple things like moving focus from a negative to a positive outlook. So shift the focus from restriction to abundance. So for example, rather than I'm not eating meat anymore, it's how many plant-based delicious recipes can I discover? All of this is not easy. Let's recognize this. So the next step is about discovering what works for the person that you're working with. Lifestyle medicine and moving towards living in a greener approach is a process of continuous learning, continuous adaptation. And we need to recognize that it won't always work for our patients. They will get disheartened, they'll run into barriers that they can't work around. So it is about supporting the people that we're working with in experimenting with new behaviours and adjusting their goals, and just basically taking the pressure away from them. Sometimes that's really difficult for us as health professionals, because when things are not going well, we start to take responsibility, we start to internalize it. Oh my goodness, the patient's not making progress, what have I done wrong? But actually, let's take that responsibility off. Yeah, let's share the journey together. Let's think about how can we move forward? What is possible? What else might work? So encouraging people to think about, well, what works for you? And really being creative and almost playful with it. And this does take follow-ups. It does take sharing those decisions and the planning with your patients. And I recognise in our current NHS system, it might be really tricky because of time constraints and restrictions on how we can follow up patients. And then we run into the problem of people going to see somebody different. They get mixed messages from other clinicians, and this means that they lose their momentum in moving forwards. But it's all about finding opportunities to check in, to monitor, and to adjust plans. Be really clear about what does success mean, but whatever way you choose to measure success, keep that growth mindset of learning and going back and re-experimenting, almost playing with it in mind. Now, lifestyle medicine is a journey of lifelong learning, especially when applying it personally with one person at a time. And at some point they will get stuck, and things do change all the time. So when people meet obstacles, take a step back, sometimes all the way back to the beginning, and start right back at the first step again, and really listen. What is happening right now? What makes this important to the person? What matters right now? And we can go right back to the beginning of the framework and start all over again. So here we have it. These are 7 steps to supporting your patients, to implementing behaviour change, to support greener practice and lifestyle medicine at the same time. I would be delighted to take any questions. Thank you for having me today. And if you want to get in touch with me afterwards, do get in touch either on social media or via our website. Thank you so much.
Thank you, Caroline. That was a really interesting talk, and it's really interesting to see those steps going up. And I think certainly in my experience, it's really enjoyable with patients when they've never really put themselves out of their comfort zone before, for them to realize that they can do that. And changing their mindset is really can be a very enjoyable and a real sort of growth experience for them. And then once you've made one small change, it becomes much easier to make bigger changes. And life is full of surprises, and we have to be mentally flexible and adaptable to cope with a lot of these issues. So a question that's coming through is, could you share your greatest triumph or your most interesting or enjoyable, satisfying a patient in terms of what you've been doing with this?
Oh, thank you, Maria. It's so difficult to pick just one patient, but because there have been so many success stories. But I think one of the things that really always sort of hits me is when I've been doing an initial assessment with a patient and I've spent time with them, I've got to know them, I've listened to what's going on for them, and the patient then at the end of the session says something like, "Oh, thank you, doctor. You're the first person who's really listened to me." And that's really bittersweet, because I absolutely know that everyone they've seen before me is doing their absolute best and probably has listened. But the difference is that the person doesn't feel like they're being heard. And one of the statistics I shared in my talk is that 40% of patients feel like they're not being as involved as they want to be. So being able to offer that to patients, and that's the exact reason I put it as the first step of my framework, is that it's something that we can all absolutely do, is that really good quality listening, so patients feel like they're involved and they feel like they're heard. Because that is, for so many patients, so therapeutic in itself. And if that is all that we do, then everything else kind of follows on. Then that is potentially enough. What else works? What for success stories? There isn't one particular thing, because every patient is absolutely unique and individual, and we to think about all the different pillars of lifestyle medicine. So my usual sort of strategy with people in my practice is to kind of do that initial assessment and go through, well, all of these things are contributing, and often that does look like the pillars of lifestyle medicine. Look at all the things that are contributing to your health, but then handing that back to the person that I'm sat with, going, well, of all these things that are contributing, what would you like to start with? What will get you the most progress forward? What's the most manageable for you? And sort of take my sort of, well, I think this is the most important bit as the clinician, take that out of it. I mean, obviously, at the same time, we have to be safe. If there is something that is clinically urgent and necessary, then I will discuss that with the person. But so much of it can be person-led. And that has, time and time again, I've seen that as a successful strategy. So there isn't just one thing. It's very much being led by the patient.
I agree, isn't it? And it's about seeing the patient. And I think in primary care, that's probably a bit easier. I work mainly in secondary care now. And there are a lot of, say, perhaps the high intensity users with the chronic long-term conditions that come in, and they are still met with a bit of a bias mindset. I have to say, certainly by more junior staff, there's a lot of sort of conscious and unconscious bias going on sometimes with these patients. And I've been in a similar circumstance where you get the older, high intensity user with lots of health problems coming in, and you're the first person who's actually spoken to them as if they're a person, and not as if they're a person presenting with all the baggage, literal and metaphorical, that they come with. And another question that I have for you, actually, Caroline, is despite all our professional training, what would one need to actually become a health coach? Should we be doing an extra qualification in this? I've done some motivational interviewing myself, but really to become a health coach, should I be doing some further training? And what's the advice from someone like yourself?
Yeah, so that's a question I get asked a lot, Helen, and I think Maria, and I think that it really is about what is going to be the right path for you. How do you want to use these coaching skills? Because you can absolutely train to become a health coach, and coaching is a intervention in itself. You go for a coaching session, which is a very distinctly different thing to going to see a clinician. And so you can absolutely and coaching skills can be used in both sets of circumstances. So you can either be a health coach who is offering just pure coaching as an intervention, or you can be a clinician who uses coaching skills within their clinical practice. And just going back to what you were saying before about clinicians who may be biased towards certain groups of patients, I absolutely think that every clinician everywhere working in every clinical setting can use coaching skills in their practice. And I absolutely think that every single clinician should be taught coaching skills, whatever specialty they work in. It would make the world a much better place. However, being a health coach as a distinctly separate role does need some specific coaching training, because it is a separate profession to being a clinician in whatever clinical role you work in, and there's a sort of a sort of standards of practice that you need to be aware of how you work as a coach, which is very distinctly different to being a clinician.
And I suppose another question for you, which I struggle with as well in my practice, is how do you make that introduction, or do you make that introduction into planetary health and to what's going on in the climate and the environment? Do you plant seeds with your patients when you're coaching them?
Yeah, so when I'm coaching as a coach, it's very much about offering information if people need it, if they're not aware of it, but then offering it and going, well, what does that mean to you? The coaching approach is putting the person in the driving seat, making them at the heart of everything that you do. Coaching is non-directive. We're not advising, we're not prescribing, we're not being directive at all. But we can share information. The aim of coaching is to increase the person that you're working with, their knowledge, their skills, their abilities to manage their own health. So if they have a piece of information that might be helpful, if there's a piece of information that might be helpful that they don't have, we can offer that information, say, have you heard about this? How would you like to learn more about it? Can I share some resources? And then we can have a coaching conversation about, well, how does this relate to you? What do you make of it? How might you use it? So being able to signpost and share evidence-based information is part of the coaching process.
Fantastic. So some good links there to be used. Right, it's almost 11:45, and I think it's time for a 10-minute break before we come back for Dr. Helen Monk, who's going to talk to us about the environment and brain health. And so I hope you all get some fresh air, some sunshine, hopefully, and a little bit of movement, get the muscles going, get those myokines pumping through your bloodstream. And we'll see you back here at 11:55. Enjoy.
Hello and welcome to Environment and Brain Health. This talk is entitled Brain Plasticity, and I'll just tell you a little bit about myself. My name's
We appear to have a slight technical issue. Is
in
Helen
2020
and presentation available at the moment?
Helen, I don't think we can hear you. I can't hear you. I don't know if everyone else can.
Hello and
let's
welcome
have a look
to
at that
Environment
first.
and Brain Health.
Fab.
This talk is
We can see you now, Helen.
brain plasticity,
And hear you.
and I'll just tell you a little bit
Fab.
about myself.
The floor is yours.
Helen Monk. I was a GP for over 20 years, but in 2020 I had a traumatic brain injury. I recovered very well physically, but the experience left me deeply curious about brain healing and how we might optimize recovery.
We can hear Matt, Maria. I think the audience and us can all hear.
And it led me to a broad investigation into neuroinflammation and neurodegeneration. Now, increasingly, I found myself going down the road of environmental factors.
Can you hear us, Helen?
Microplastics
Yes.
as potential
Brilliant. The floor is
contributors
yours.
to brain disease. So today I'd like to share my latest findings with you, not just as an academic interest, but as a potential public health crisis unfolding possibly in real time. So emerging literature is increasingly implicating environmental pollutants in psychiatric and neurodegenerative disease, for example, heavy metals, pesticides, air pollutants, dietary components. But now microplastics have been shown to have an increasingly important role in neuropathology. So this talk is going to just focus on microplastics. What are microplastics and where they're found? How do they affect the brain, and how can we minimize their harmful effects? So before I start, I thought I'd briefly cover the history of microplastics. So in 1970, it was the birth of industrial plastic with a massive expansion of types and applied uses after the Second World War. Production and development of plastic products accelerated, leading to this throwaway culture and the rise of single-use plastics. And it wasn't until the 1960s that we started seeing plastics in our oceans. And then it wasn't until 2004 that Professor Richard Thompson identified or coined the term microplastics to describe the tiny plastic particles that were accumulating in the oceans and rivers. And they were originating from the breakdown of larger plastic debris, as well as from sources like clothing and microbeads in cosmetics. So it's quite a complex area. There are many types of plastic, many types of microplastics, very hard to study because there are also chemicals embedded or around the plastics. They vary in their sizes. There are fibers, grains, granules, fragments, films and foams, and their high surface to volume ratio makes them very capacious absorbents of pollutants and microorganisms that create biofilms, all adding to their toxicity and harm that they can potentially do to cells. So if we just look at what are microplastics, well, they are broken down into primary and secondary. Primary are manufactured as a small, minute plastic product, for example, microbeads found in cosmetics and cleaning products. Secondary microplastics are essentially fragments of plastic that has been broken down, for example, abrasions to vehicle tires, coatings from marine equipment and paints, cigarettes, decomposing water bottles, tea bags. And their sizes originally were classed as less than 5 millimeters, but as time has moved on and science has improved in identifying these particles, initially they were microparticles and now they are nanoparticles, and these have literally been identified in the past couple of years, less than 100 nanometers in size. These are the size of viruses. And we discussed a little bit about plastic type. There's a huge variety of plastic types like polyethylene or polyvinyl chloride. And on top of this, we have the chemicals we have to consider with regards to toxicity. They're often coated with forever chemicals. These are chemicals that cannot be broken down by the body, or forever chemical food contact chemicals. This is when chemicals leach out of plastic and coat the food and we ingest them. So forever chemicals that, as I mentioned before, cannot be broken down by the body. They reside within the body and they're found in plasticizers, lubricants, dyes and biofilms. And then food contact chemicals are very interesting. A 2004 study identified 14,402 contact chemicals, of which over 25% were identified in the blood, hair, or urine. 80 of these have been shown to be toxic, cause cancer, reduce fertility, birth defects, and 59 of them had no safety information on them at all. So, an emerging area. So where are microplastics found? Well, basically from the Arctic snow to the bottom of the ocean. Last year, 500 million tons of plastic was produced, of which 400 million was wasted. Only 11% was recycled. So this plastic can be burned, buried in landfill, get broken down. But essentially throughout the years, all these particles slowly, a variety of sizes, have ended up in the air, in water, that's in rain, ice, surface water, groundwater, and the soil. Eventually, over 80% of microplastics end up in the soil, and so obviously affect farming and the production of food. So how do the microplastics actually get into our body? Well, there are 4 mechanisms: ingestion, inhalation, absorption, and placental transfer. Ingestion, primarily, obviously, food and water. An interesting study in the UK looked at 177 tap water samples from 13 cities and 85 samples from 17 popular brands of water and found microplastics in all of them. The study identified that babies ingest 4 times more microplastics per kilo per body weight per day. And babies who are bottle fed literally ingest millions of microplastics or microparticles a day, especially if these bottles are sterilized, made with formula, and if they're heated to, this is heated to 70 degrees C, and also if it's shaken and the plastic is primarily polypropylene. So bottle-fed babies are very vulnerable, but also microplastics are found in salt, in beer, meat, fish, seafood. I mean, essentially they have been identified everywhere. Inhalation, there is outdoor inhalation where the microplastics are predominantly from tires and exhaust fumes, and indoor microplastics are primarily from clothes fibers, cleaning products, furniture, and it can be very variable within the air of a particular building. And finally, placenta transfer. Well, 100% of placentas were identified as having microplastics within them. So just this slide is a brief summary of what we've been covering so far. You know, microplastics are present in our everyday life. They become waste, they're broken down, they go into the soil and water, and then they're ingested by humans. And they've been found in almost every single organ of the body. And we can't ignore poor animals. The presence of microplastics has also been well documented in animal health. So how do microplastics enter the brain and where are they found? Well, microplastics enter the brain through the blood-brain barrier. This was originally thought to protect the brain from harmful substances. However, these nanoplastics, which are smaller than 100 nanometers, the size of viruses, can potentially cross through the blood-brain barrier. There's also endocytosis, where cells take up or phagocytose plastics. There is the olfactory route. As we smell, we inhale microplastics that migrate into the olfactory nerve and into the bloodstream, into the brain. And as we ingest them, the microbiome in the gut, which is very important with regards to inflammation and gut-brain signaling, can become disrupted and also affect the brain. So I want to talk about a recent study that was published in February of this year, 2025, by Matthew Camden and his group in New Mexico, and they analysed 52 samples from 28 patients taken in 2016 and 24 taken in 2024, and they looked at brain, liver and kidney tissue, and they used a new technique called pyrolysis, gas chromatography and mass spectrometry, which essentially identified micro and nanoplastics. And they were able to identify lots of nanoplastic that had previously not been identified, and they were able to show that this plastic actually was crossing the blood-brain barrier. And if we look at the slide on the right-hand side, you can see the blue is 2016 and the orange is 2024, and the liver and kidneys show roughly similar amounts of microplastics, but the brain in 2024 had almost a 50% increase in microplastics over the 8-year period. And they were able to do some rough calculations, and they thought there was about 2 grams of plastic in the frontal lobe, which was very interesting. They also were able to show that the main source of plastic in the brain was polyethylene, and that people with dementia had 10 times more plastic in their brain compared to those without dementia. So I'm just going to skim through a few other interesting facts about microplastics. So microplastics affect all ages. It's really about certain people are more susceptible to microplastics, predominantly children. We know that 100% of placentas are probably contain microplastics. Microplastics has also been identified in meconium, meaning it will have transferred through the placenta into the baby's body and then being excreted into the meconium. Infants ingest 10 times more microplastic than adults. And that's really because, they may have plastic bottles, they're crawling, they're putting things in their mouths. Studies have recently shown that microplastics do impair cognition. This has been in studies in bees and mice. It's been implicated in, or associated, should I say, with ADHD. An interesting study in 2021 identified that there had been a 787% increase in ADHD and ASD diagnoses in a 20-year period between 1998 and 2018. And they just put that down to increased awareness, increased diagnosis. But I think it'd be very interesting now with all this emerging evidence if there could be other factors contributing to this increase in diagnoses. There have been studies also showing that the microplastics are associated with increased anxiety and depression and suicide, and as we've seen already in dementia. So in 2018, there was a study identifying that the cost of disease and disability associated with plastic chemicals exceeded $920 billion in the States. So again, it'd be very interesting to see if, 10 years later, what cost could be calculated. And I think what we are all thinking about is how can we reduce our plastic intake? Well, I think as health professionals, we have to make every consultation count and try and implement what the is suggesting when they brought out their information on communicating on climate change that we need to talk about plastics and plastic usage, because not only does it have an effect on climate, it has very much an effect on personal health and the health of society. A good way of possibly thinking about how can you reduce micro plastics is thinking about consumption. I always think natural, try not to drink from plastic bottles, minimize bottle feeding, avoid tea bags, avoid plastic in the kitchen, try and cook from scratch, having that whole food, plant-based diet approach. Obviously, there's more concern with plastic in water, but this can also be boiled and has been shown to minimize or reduce microplastics as the plastic precipitates out in mineral deposits. Thinking about supermarkets, they could be very influential in reducing microplastics. They could supply refill solutions, but actually as consumers we could reduce buying plastic packaged products, especially drinks, and really try to buy local, buy loose, organic and seasonal. When you think about inhalation, thinking about walking and cycling rather than traveling in a car where you are exposed to more microplastics, think about your route, go on the least busy route, clean your house regularly, open your windows, use the natural cleaning products, furniture purchases, and absorption, again, thinking about natural creams, shampoos, natural toothpastes as much as possible. So, in conclusion, is this a medical emergency? Well, we can see that microplastics are going to affect everybody. I think it's really important that we support the research, because we are starting to get some, now that science has advanced and it can identify these microplastics, we now can try looking for them and find some more associations or causations. We really need to think in the meantime, act now, think about the way we live and try and reverse engineer it, go more natural rather than more commercial and manufactured. And these are simple measures, they're not complex. Our ancestors or previous generations lived in this very natural way quite easily. And we do have a degree of consumer responsibility. We need to support our governments and encourage them to make sensible decisions along with the UN, because ultimately, not only are we looking after ourselves, but we do need to protect our children. They're very vulnerable, and protect the future for them and for our planet. So thank you very much for listening. I have a raft of references should anyone wish to look at them. And yes, thank you for listening.
Hi, I would just, whoops, let's get my video on. Just like to say an enormous thanks to you, Helen Monk, because what I have had in my head for years and years, it's so good to see that it's down on paper, that it's evidence-based more and more, and that actually we're all talking about it. And actually we know now we should be talking about it with patients, because that's the block I keep coming up against. And you can be a little bit of an outsider for a while. People think you're slightly left or centre, but actually now we're coming right into mainstream. And so thank you very much indeed for that. And Matt is going to do the questions.
Inspiring, wonderful, exactly. It shows that overlap between planetary health and personal health and what lifestyle medicine can do. There's a couple of questions and then a comment. I wonder, with water-based lubricants recommended for women for better sexual experience, are they also at risk of danger of microplastics? That's a hell of a starting question, isn't it? Straight into section. It's only 12:20.
Yeah, well, that's a difficult one. I have to say, I wouldn't quite know. I mean, it could be looking at the tube if it's what sort of plastic. I mean, it'll be small amounts, I'm sure. I mean, I think there are probably bigger issues of ingestion and exposure than a bit of microplastic. And if it keeps you happy and in a good relationship, that there's probably a balance somewhere around there.
Absolutely. And I do feel that was a slightly unfair first question, but I think you're absolutely right. It's can we go for the big bits first, not the 0.1% of stuff, when there's some other 50%, 80%, 90% of things that we can do elsewhere. The next question is probably a little bit easier. Are there simple resources to share with colleagues in work who microwave every day to heat their lunch in plastic containers? So are you aware of resources that might be available? And then the next question is also about microwaving or boiling bottles for babies. So what would you suggest we recommend to parents of bottle-fed babies who sterilise their bottles by microwaving? So I think that they're kind of related questions of heating plastics in a microwave.
Yeah, I mean, I think the bottom line is, just go natural, just try to use glass or china. Yeah, I mean, the trouble is, again, it's an emerging science. If it's a ready meal in a microwave container, we know that the more processed the food is, the more microplastics that food will have. So go homemade food, go whole food, plant-based, and try and reheat it in a china plate or something, and put another plate on top if you don't want it to dry out. But I think you just have to, I mean, I'm compiling sort of solutions that hopefully I'll make available, but it is really stripping all these things back and keeping it simple, but just trying to get rid of the plastic. I had no idea, I have to say, until I started this journey, how toxic these plastics are, because the science these papers are literally just coming out the past couple of years. The one about nanoplastics was just this year. So I think, we don't know. So the key thing is just try and minimize it. I think going back to the babies, I think we have to really, really support breastfeeding for women. And I think if you do have to use a plastic bottle, maybe clean it in the dishwasher or hot soapy water, and use maybe cool boiled water to make up the feed rather than cold, and put it in a microwave, that sort of thing.
I'm as the special interest group co-chair, it would be great if there was an infographic that you might want to help us write, help contribute to.
Okay.
So we myself and Maria may well be in touch and sort of say what would be those key take-home messages, which could help answer some of the questions about microwaving and plastics. We've got a question about any information on babies' dummies, pacifiers for those outside England.
Well, it's difficult, isn't it? Because I think, the science behind all these, if you want to go, oh, there's a paper showing this, it's difficult to get that sort of information. But I think if you could just extrapolate, the less you expose yourself to anything plastic, the better it is. I guess, though, again, you've got to get that practical kind of solution is, you may, as a mother, listen, we've all been there. You need that solution, but maybe just trying to minimize all these things in your, day-to-day life is really important. But, you can't do any of these things overnight. And, it's a balance, isn't it?
So it's very much about reduction rather than beating yourself up and feeling guilty.
Oh,
100% plastic free. And I think that's kind of that persistent take-home message. It's make the changes that you can. Don't feel guilty. Sorry.
Baby steps.
Ta-da. There's a couple of questions about BPA-free plastic bottles and should we be going to other materials. And again, I think that you kind of, if possible, move to plastic, glass, china, move away from plastic where possible. But plastic is quite useful, and it's where that fits in in one dummy once is different to every single time you take a drink?
Well, I think it is that whole, I mean, honestly, it's so difficult to deplastify your life. I think you can, do the kind of just one thing and just try to do it as often as possible, but there will be times when it doesn't work out or you don't have the equipment or whatever. Yeah, I mean, it's really difficult because if you really start going through your house or your day-to-day living, the air is full of plastics, but you almost get yourself into real tears and get that eco anxiety. So I think, being kind to yourself, baby steps, little bit, just trying to minimize. I'd say just the simple things are probably packaging. Start doing that so there's not, your food isn't covered in it, and you're minimizing that single-use plastic is really what affects, I think, so much of us. And BPA is being removed from a lot of plastic purchases, say, but it is still there. You can only just do that baby steps thing. But personally, I do feel we should be lobbying the supermarkets to make more of an effort, because our behaviors are very governed by what they deliver to us. So it's very hard to kind of fight back when your options are very limited.
So I'm going to wrap up, because I know that we're at nearly 12:25 for Fiona. So I think that by the sounds of it, if we are asking people to make a pledge, there are individual things that we can do, reducing our plastic. There are also societal things that we can do in terms of lobbying supermarkets and others. So a pledge could be either or both of those. I'm going to say thank you very much to Dr. Helen Monk. That was fantastic. Dead on 12:25. It gives me again great pleasure to introduce Fiona. Fiona, if you want to, and this is something we're going to have a 50-minute lunch break after this, and I'm going to go in the garden. So please, Fiona, over to you.
Hello, everyone, and thanks for your interest in therapeutic horticulture. My name is Fiona Thackeray. I'm the CEO of Trellis, which is the main organisation for therapeutic horticulture in Scotland. This rather long title, Physical, Dietary, Sleep, Brain Health and Social Outcomes in One Planet-Friendly Package, tries to encompass the wide-ranging health benefits of therapeutic gardening and the fact that most of the activities involved in this practice are generally good for the environment and help foster a positive attitude and protective behaviours towards our environment. We speak about therapeutic horticulture sitting in the intersection between the horticulture profession and the health and care profession. So it's this darker shaded area in the middle. It sits in here, but it is also a unique profession and practice in its own right. And we define it as the use by trained practitioners of plants, gardening and nature connection to help people to improve their health and well-being. And really involves people being very engaged in that process. It is not generally terribly passive. Even if it's not terribly physically active, people need to be looking at the environment, taking in and observing the environment in some sense, really to get the best out of the practice. It marshals the benefits of contact with nature to augment therapeutic practices, and those benefits are very, very many, more than we'll have time to outline here, but I think some of them you will recognise from your own experience. By involving living plants in the natural world, it brings a new dimension to this therapeutic practice, including an extra level of sustainability. If you think about adherence to lifestyle interventions and therapeutic prescriptions, the adherence rate can be quite low, but in this field, we find there's a high level of adherence, and we think a lot of this is to do with the fascination that we have for the natural world. We're always interested in seeing what's happening, and our attention is naturally, innately drawn to noticing things in natural scenes that they are not so much when it's an abstract or a man-made environment. Taking care of a garden or being immersed in a garden and practicing gardening seems to foster protective attitudes towards the environment. And there is an inherent inclusivity because the natural world has no clinic hours. It's outside your door. Even in very small doses, sometimes there might just be a couple of pot plants outside your door if you're in a very urban environment, but it can be there whenever you need it. So it has those particular advantages. The many benefits of therapeutic gardening are too numerous to get into in this presentation, but I want to focus first of all on the pink one, the physical activity, which I think most of you will appreciate is a bit of a wonder drug. If we could bottle it, we would, because of the way it reduces so many risk factors for so many of the most common public health threats and so many of the conditions and diseases that trouble our population so badly. It's really great for helping against cardiovascular conditions, strengthening our musculoskeletal systems. It can help against diabetes by helping people stay active and possibly stimulating interest in healthier eating, and many other similar risk factor reductions. It's great for back pain, although some people do damage their back during gardening. It has to be done carefully, and there may be good links to immunity too. It seems that being physically active in the garden is something that's much more sustainable, possibly again because of this fascination we have with nature and the fact the natural world and the wildlife there and the changes that are always going on seems to draw our attention quite naturally to it. And so there's an interest there beyond just doing some exercise because it's good for you. So you do it, the gardening, because it's meaningful and joyful, not first of all because it's good for you. And lo and behold, you get the physical activity benefits and the other health benefits that come with it. This physical activity in particular comes with a huge boost in mental health. I know many physical activities do boost mental health, but gardening in particular seems to be correlated with reduced risk of dementia. It seems to be a solid way of approaching depression and helping keep depression symptoms at bay for a fairly long time. And it's great for anxiety and stress reduction. We hear people talking a lot about how immediately on getting into a garden or even just being near plants, they feel calmer, and we've seen that measured. Lots of interesting studies coming out of Japan and Korea where people's heart rates and blood pressure and so on are measured, and their skin conductivity and cortisol levels in saliva, and they all point to reduced stress and anxiety during gardening. It also seems to naturally bring on a mindful state without having to do a mindful practice, having to go and do a separate mindful practice. It does seem to be good at restoring us cognitively after a stressful time or a painful experience or a long, tiring day, and people typically report better sleep. Of course, it helps reduce isolation as well, because gardening quite often is done in groups, and gives a structure to the day as well as to the year, because we notice the seasons and we plan ahead for the next season by growing things, sowing seed now that will come to fruition later in the year. So there are all those cycles and social benefits that help people feel part of something bigger. I'm going to stop there with the benefits because we will run out of time otherwise. We work with all kinds of people. We can work with almost anyone, from people in terminal care, in hospices, kids and adults, to people in custodial settings, in prisons, and people in working in a health and mental health project in a huge walled garden, to people tending a tiny courtyard garden or a few pots outside the door of a daycare centre. So we work with people in care homes, older people with dementia, in their late old age, and people with neurodiverse conditions and autism. We work with people with disabilities, physical disabilities and sensory ones, and a large cohort of people with extra support needs, possibly in daycare or having some sort of supported services, supported living services. Many of the projects, this big orange segment, work with a huge mix of groups coming on site, either on different days or together. It's also used with rehab for head and spinal injuries, and stroke and cardio rehab too. So there's a huge range of groups we work with. Quite often what we see when people are talking about environmental concerns is a rise in anxiety, and that's obviously not helpful for our health in general, but also it can have a paralysing effect on people. So it's much better if we can take that concern for the environment before it becomes anxiety and channel it into practical actions. And that's something that gardening does really well. It allows people to tend a small, manageable part of the world, of their natural local environment, and raise plants and see their efforts having a positive result, which can cause a boost to self-efficacy and confidence. Your actions led to good things happening, so I can't be all bad. I'm good for something. The physical activity increase does tend to create a feel-good virtuous cycle, and the de-stressing benefits that come along with that make for a good tool for sustainable habit change. We see sleep quality improving, as I said, but part of that might be to do with circadian rhythms becoming better established and rebalanced, plus the feel-good brain chemicals that come from daylight exposure. So being outside just makes you feel better, and then you want to do it more. So again, hopefully another virtuous cycle there. We see people also having better feelings and increases in some neurotransmitters because of the reductions in loneliness of gardening with others and feeling you're part of a group and not so isolated. And also a feeling of doing good in a sort of multiplied way because the whole group are working towards the same goals. So that's also a really good feeling and something that multiplies the more you do it. I think particularly for people who've been ill for a long time, perhaps with long COVID, or had a cyclical illness that comes and goes, and they don't seem to have a good long spell of good health that they can trust, or people who maybe have a visible disability or physical disability, for example, being seen to contribute to their local environment and to shape a small piece of land into something more beautiful or productive is a really important boost to your self-image, to your feeling that you can do something useful, that you can be an eco-activist too if you want to be, and it does help channel that potential climate anxiety into something practical, practical action. Also being in a garden can help us gain perspective because it takes our attention to things that are bigger than us and outside of ourselves. So the climate and the weather, we're looking at the cloud patterns and the what's coming in, what does the weather look like it's going to do, and how's that going to affect the garden. We're looking at the soil and the quality of that and the life in the soil. Are there worms in it? The geology beneath our feet. We're looking at the other creatures in the garden, the wildlife that visits and their struggles and life cycles, and the other people we're gardening alongside. So it helps us have a sense of our niche in the wider natural world and the relative importance or not of that. And it helps us gain perspective because it helps us put our troubles and struggles in that bigger world perspective. And also we notice patterns in the seasons and in species arriving, migratory species like butterflies. We notice patterns in clouds and in weather and in seasons, the swallows, the first blossoms, and that helps us have hope and a bit of trust in the cycles of the planet. Garden tends to be where we first explore the natural world. It's where our first connections with nature and experiences of the green world out there happen very often. And that helps instill curiosity and that important link with the natural world. It also gives us a feeling of being comfortable and confident in the outdoor world because not everyone has that, and it doesn't come easily if you don't get it early in life. It's a great antidote to screen time. Just shutting that phone, shutting the laptop and going outdoors, you can forget a lot of the nonsense that goes on online. It helps your eyes recover from that exposure to blue light. And it does seem to be important in stemming the rise in childhood myopia, which seems to be happening, I think, globally recently. So having more time looking at the outdoor world seems to be correlated with a reduction in myopia in children. It's when the garden is where we first start to develop a sense of ourselves as one part of a bigger natural system, part of the wider world. So we're one cog in a bigger wheel, and that's important for our understanding of environmental issues as well, as you can imagine. There's also clear evidence that children learn better, all of us actually, but particularly children, learn better after and during time spent outdoors. So it's partly this cognitive restoration effect of being in a natural setting, but it could be lots of other factors. We seem to then do much better if we have to go back into a classroom to learn. And also just if we stay outdoors, we are more receptive and we seem to be in that kind of learning, connective, neurological state that is good for learning. The garden is also a good place for environmental awareness to begin. That's that up-close contact with nature, interacting with soil, touching leaves, smelling flowers, and noticing a robin coming to pick up some seeds or some fruit from a worm from the soil. We start to see those interactions and those interdependencies that we know are going on in the world, in the natural world, but we don't always stop to notice. And this very personal connection can foster a really strong motivation to be protective of the environment. If we don't experience this nature, this sense of being part of nature firsthand, it can remain quite a distant concept and quite abstract, and therefore we may find that people have a less concern over conservation questions. And there is evidence that if we don't have early exposure as a child to green spaces, then we won't go into nature as often as adults and use all the benefits that come with that. And there's documented evidence of that from Catherine Ward Thompson and colleagues at Open Space Centre in Edinburgh. So the recent study of social prescribing from the National Academy for Social Prescribing shows a marked reductions in frequent appointments to GPs and A&E appointment attendances, huge reductions there for people who have access to social prescribing. And what we see happening with therapeutic gardening is you have all these benefits of social prescribing and the additional benefits of nature exposure on top. So the sustainability of habit change that lasts because you're in a green space, somehow that makes it more sustainable, possibly because it's meaningful and joyful first, and then you keep doing it for that reason, but you're getting extra exercise or you're getting mental health benefits just by continuing to be in the garden. It seems to bring on this mindful state without the counting of breaths, without the chanting, and the fascination for living things does seem to be a great antidote to screen time, but also one of the things that sustains our attention, sustains our habit of going to the garden. The research base is pretty strong and growing. So therapeutic horticulture is an evidence-based practice. Some of the main research studies, the most interesting ones possibly, are cited here on the right. So clinically significant reductions in depression scores for people who had therapeutic horticulture sessions in a study from Norway in 2010, Gonzalez et al. And those reductions in depression were seen at 3 months later, so sustainable reductions. Our conference speaker last month, Dr. Carly Wood at University of Essex, published useful overview of the evidence for therapeutic horticulture being useful for depression and anxiety, and she also made some really helpful infographics for doctors and patients and commissioning organisations, and you can get those through the link on our website. Our colleagues in New York found that therapeutic horticulture was really helpful in inpatient cardiopulmonary rehab. And gardening is associated with longevity, healthy aging, and life satisfaction, according to the Lothian cohort study here in Edinburgh University. It's a longitudinal study. There are also good evidence from Australia suggesting that gardening is the main thing for reducing dementia risk. It was more powerful than walking or reduction of alcohol consumption. Colleagues in Singapore have been studying inflammatory markers in blood samples from older populations who were involved in gardening and found lower inflammation there as a result of gardening. And we have connections with groups in Hong Kong where there's very little outdoor space. It's really highly urbanized, but it doesn't stop them gardening. So they do a lot of balcony gardening and indoor gardening. And that does seem to help people to stay healthy right through the lifespan. We haven't got data from Hong Kong yet, but certainly people vote with their feet and get involved on quite a wide scale. So the hint from that is that you can garden anywhere, and it doesn't need to be you don't need to wait till you've got 3 acres in a walled garden to use. We're also looking into studying useful protocols for Parkinson's. So therapeutic gardening referrals work something like this. We think ideally it takes 10 to 12 weeks to have the best benefits, but people feel better after one session. Adherence is high, as I mentioned, so it therefore is a very cost-effective route to recovery that's sustainable and a preventative measure too. It can be used for recovery, rehab, and prevention. There are no known side effects in overdose and overdose risk, sorry, and the hubs and spokes model can apply. So we can have a hub for more intensive support and then link into community garden settings and have people move out to those when they need less support and back if necessary. And typical measures for looking at improvements are listed here. Also, life satisfaction schedules, self-reports, depression scales, anxiety scales, pain measures, and also informal diaries and feedback. But people also will measure blood pressure, sleep quality, and so on. And repeat appointment frequency, as we saw with the social prescribing studies. Just a snapshot from some of the projects in our network. Here we have a large walled garden in East Lothian, which focuses on mental health. People are growing food here. A polytunnel in Orkney, this gentleman's harvesting peas at a mental health project. And inner city Glasgow here, there is no limit on where you can garden and keep chickens or grow rhubarb. You know, this is hard standing here, but they've found a way. They've got tires on that hard standing and filled them with compost, and the rhubarb crop looks good to me. Just to make the point that really you can garden anywhere, and we can give advice to help people adapt to work with any client group. As if to emphasize that point, we've been gardening in Barlinnie prison in Glasgow, where it's mostly hard standing, like you see on the bottom right here. We've just had to create built up raised beds and polytunnels so that people can garden there, just like they do in Hong Kong. Find a way around, you know, gardening in a very urbanized place. We have gardens in high secure units in hospitals, and there's also a very beautiful garden on the roof of Aberdeen Royal Infirmary where patients can actually go out in their beds if they're not able to get out into a wheelchair or to walk. So there shouldn't be any limits. These are some of the environmental benefits that we see in garden projects. There's a whole reuse, recycle, repurpose attitude. Nothing's wasted as far as possible. So scrap wood is used to make compost bins here on the left, and food waste goes in here as well as garden waste. Fallen leaves are raked up to make leaf mold, which is great for raising seedlings. And of course, animal waste as manure is used on the beds to make the soil richer. And we will use wood chip to cover paths and mulch areas that we don't want weeds coming through on. And of course, save rainwater to use as a water and irrigation source. The gardens in our network are doing something quietly all the time, this mysterious connecting with nature, fostering that for people. And so whether that's through filling up a bird feeding station or just climbing trees or sowing carrot seed, there is this feeling that through taking care of our green spaces, we feel better. And then that feeds a desire to spend more time in nature and to take care of those environments that we've come to feel so good in and treasure. And so we get this local feeling, which hopefully spreads globally. But if everyone is taking care of their little patch of land locally, that's also fantastic, you know, even if they don't develop a global conscience about a wider planetary sense of taking care of the environment. Plants, of course, if we plant plants, we're sequestering carbon from the atmosphere, especially shrubs and trees. Plants help filter air and help prevent flood and erosion. As soon as you take away the plant cover, you get really disastrous flooding, and you start to lose air and soil to the erosion, to the effects of erosion. And also plants are useful for helping filter the air. So there's lots that goes on in a garden, or just having some plants on a balcony that help improve our environment. And aside from these feelings of environmental protection and conservation. So if you're itching to start doing some gardening where you are, or refer patients to a local garden, there is our map and directory on our website. There's also Gardening for Health, which .co.uk, which covers some English and Welsh projects. And you can maybe call Thrive, another charity in Reading, which is in touch with many projects in England and Wales. If you want to start up some gardening, perhaps with the support of a link worker at your own clinic or base, contact us for help on how to do that. It could be just a few pots or a window box. We're happy to help. There's no plot that's too small. And do sign up for our live demos, which are free 1-hour sessions with lots of ideas for gardening activities or nature connection activities that are seasonally appropriate and adapted to people with different health conditions. Come along to our other events to do with developing our professional association, or networking in general, just to meet others working in this field. We know that the situation isn't ideal at the moment for finding information on therapeutic gardening projects near you that are operational and that take the people with the needs that you want to refer. So we're working on a census to update our project data, and we're working with researchers and also other partners in this field to try and create some form of directory or data source where you could look that up easily and find the projects near you that are open to referrals. So do get in touch if you've got any thoughts about how that should be, how that should look, what would help you, and be assured we're working on that as fast as we can. All right, thank you for listening. I think that's probably all the slides I've got. Certainly all the slides I've got time for. If you're interested in helping promote this work, World Therapeutic Horticulture Day is on the 18th of May, and we'll have some free resources and hashtags and slogans and press releases and so on to share on our website. Any other questions, here is our website and email address. We'd love to hear from you. Thanks for listening.
Thank you very much, Fiona. That was really interesting, and it's really interesting to see how people, even with large gardens and large plots or window boxes, can still get that big benefit from getting involved. And I read recently, I think in the Good Nature book, that just getting your hands into good quality organic compost and that dirt underneath your nails for 20 minutes twice a week might be a way to hack the health benefits for the lazy people like myself who don't want to go out and do it in the garden. Do you think that might work? And should the gloves be off when you're gardening? I guess more importantly for the gardeners out there, should we be taking our gloves off and really be getting the dirt under our nails? Is that what is giving us this big health benefit?
I think that's a small part of the benefits. Can you hear me all right? Yeah, I think that sort of contact with the microbes that are in the soil is a small part of it, and just the feeling of being in touch with the earth, because it's such a long ago connection. You know, we've been raised. We started sleeping on the ground, I guess, and we were walking barefoot for many years until someone invented shoes. So there is this environmental connection, an inherited thing that we think is part of it. But I'm not sure if you would get much of the other benefits because of, you know, the sort of changing tapestry of nature and birds coming in and so on. So you get some of it for sure. And I think gloves are always optional. We say, you know, you wouldn't have that same feel, but for some people that's not the main benefit. I had some visually impaired clients who really didn't want to touch the soil because they didn't know if there was a worm there and they didn't fancy that. So, you know, gloves are really personal. So yeah, over to you on gloves, whatever you fancy.
I suppose another question for me that comes into mind, are the therapeutic benefits from something like gardening, how long do they last? Is it like training our muscles? Whereas if you stop training, if you stop being physically active, you will lose a lot of that therapeutic benefit unless you keep training. Do you have to keep gardening, or can you do it in chunks? Will a good chunk of gardening sustain you for a long time?
I think it's little and often is best, you know, regular, just mainly for the physical activity benefits. You know, of course, it's just like any other physical activity. I think regular for the mental health effects, regular top-ups are best. You know, it does seem to endure the benefits, as we saw with the depression study from Norway. You know, that there is a benefit enduring after the session stopped for 3 months at least. Okay. So, you know, that there is a lasting effect. But I think keeping on gardening and certainly adapting your garden to suit you, you know, whether it's houseplants or just a window box or a big garden, adapting it so you can manage it and it doesn't become a morale booster rather than buster rather than booster, so that, you know, people sometimes lose someone and then their garden's unmanageable for them and it becomes a reminder of everything they can't do. That's awful. That's not going to have those same, you know, so adapting it so you can still keep managing your garden is important. But yeah, I think keeping on gardening is probably the best advice, but it does last. The benefits do last, some of them for sure.
And another interesting point you made is about myopia in children. Is that because of the distance of the views that they're looking at, or what's the science behind that?
I think it is partly that, because I think eyesight and our eye-brain connection develops through looking at different points in the environment and learning. I know there's some fascinating studies about childhood brain development where they found that kids who grew up in sort of potting areas of Mexico and using the clay and changing the shape of the clay. They understood volume the consistency of volume you take clay and you roll it into a ball, it's still the same volume that they got from just living in that environment. And they were able to judge distance better because they were used to looking ahead and mountain vistas and so on. They were lived outdoors more. So I think there's a lot of that happens in the development of our eyes and our eyesight during being exposed to the environment that is just gone as soon as your vista stops at four walls or even a screen, even closer. You're taking away a lot of that training and stimulation of vision development. So we don't really know. I don't think anyone's studied it except that noticing that it's a fact that time outside in nature seems to be an antidote to this myopia. And they don't even know that it's definitely screen time or indoor time, but they're sort of making that correlation for now, at least.
It's fascinating, isn't it? And a last and final point from Matt: how do we get rid of the fake grass?
Yeah, well, I mean, I had quite a radical diatribe about that in my plastic-free gardening book. And then one of my directors said, well, actually, for someone who is maybe physically disabled or is not managing, it might be a way of them having a garden. And if that's part of their aesthetic of what they find nice, a nice green lawn, it might be permissible in some cases and helpful. So I conceded, but I don't know the answer really, because people all think they have less time for this, but then they we make time for hours on Instagram or whatever, so it's a case of priorities, I think. And at the moment it's a lot better than it used to be, but it's still very ugly and it doesn't have staying power. It soon looks, even if it looks slightly better when you're late, it still looks terrible very quickly.
No,
so
it's about
I don't have
your priorities, the green ones.
Yeah.
Yeah.
I don't really have. I wish I did. I don't have an answer to that.
No problems. Well, thank you very much. That was absolutely fascinating talk. And we are going to break for lunch now. We've got 50 minutes and we're back at 1:45, learning about how to make our general practice greener. So again, some activity, some good food, lots of fruits and veggies if you can, and we'll see you back here in 50 minutes.
Fantastic. Wonderful. Thank you. Welcome back, everyone. Hopefully you've all had both eaten something green and seen something green in our break. So hopefully you've had some plants for lunch and you've seen some plants in their natural living world. This afternoon we're going to kick off with Terry Kemple. He's going to tell us all that we need to know about making general practice greener in only 20 minutes. So I'm going to hand over to Terry and we'll see you for the questions. Any questions, put it into the Q&A box, and we'll see you for the questions in about 20 minutes.
So this is everything you need to know about making general practice greener, all in about 20 minutes. I'm Terry Kemple. I have no conflicts of interest. I'm a retired GP. I've had various roles in general practice and in healthcare and in sustainability. I'm currently the director of the Green Impact for Health Toolkit. I am not a climate change expert, but I am from the generation that made it all worse, so sorry about that. So our climate change problems really started back in the Industrial Revolution, and in 1893 Munch saw the setting sun turn the clouds a blood red and sensed an infinite screen passing through nature. And then after that he painted it was called the Screen of Nature originally, and is now known as the Screen. And the Screen continues, so countries will experience many or all of the problems of flooding, heat stress, water stress, wildfires, hurricanes and sea level rise and mass migrations. And this will affect the low-income countries worse. So I don't think there's many people who think that it's a hoax, but there are co-benefits anyway if we reduce the causes of climate change. Health should improve because we've increased active transport, reduced air pollution and are eating better diets. Because we want healthy people, healthy communities and healthy ecosystems on a healthy planet. So what are our top environmental problems? Well, Gus Seth, an American environmental lawyer and advocate, used to think the top global environmental problems were biodiversity loss, ecosystem collapse and climate change, and that after 30 years of good science, we will address those problems. But now he believes the top problems are really selfishness, greed, and apathy. And we need spiritual and cultural transformation to achieve that, but we don't know how to do it. Anthony Lesowicz from the Yale Project on Climate Change Communication says there are 5 gateway beliefs about the climate change that motivate people to change. They have to believe it's real, that it's us causing it, that it's bad, that the experts agree, and there's hope. So bear in mind those things for the rest of this talk. Hopefully that will make you stop and think. So what's to be done? Well, for every complex problem, there is an answer that is clear, simple, and wrong. So we need to be aware of that and tread carefully. And in this climate and ecological emergency, we don't want a few perfect people doing every impossible thing. We want most of us imperfect people doing everything possible that we can. And in this particular session, I'm going to talk about the fact that people don't know what to do about it, and we're going to concentrate on that. And as an example, back in 2021, we did a survey of different training regions in England. The first one we did was in the southwest, but we repeated elsewhere, and the results are much the same. So we've got a 14% response rate. So that's probably the people who don't mind doing surveys or feel strongly about climate change. And that 14% thought that they hadn't really received any planetary health learning or training, or if they had, it was insufficient. But more interestingly, over 50% of them weren't aware of the 3 main resources which were available to them to help, and 25% weren't even aware of any GP resources. We've got to remember that also just providing healthcare continues to contribute to climate change. Typically 4 to 5% of greenhouse gases come from healthcare in the UK and similar countries, whereas it rises up to 8.5% in the US. And you can see how this fits in with everything else. This is a image of the carbon footprint of the NHS. On the left, it's the total NHS, and on the right, you can see it broken down by sector. So arrow 1 points to primary care, and you see there that arrow 2 shows that medicine and chemicals produce a larger carbon footprint. Similarly, metered-dose inhalers, and also travel by patients and visitors. We've got NHS net zero targets since 2020 to achieve by 2040. So we had 20 years, now we've got 15. The total carbon footprint in primary care is roughly about 23% of the entire health service. And you can see that 61% of it is clinical and 39% of it is non-clinical. And of the clinical, about 13% comes from metered-dose inhalers by themselves. That's because the propellants in those inhalers could be 2,000 to 3,000 times more potent greenhouse gases than carbon dioxide. And the other 40% comes from other pharmaceuticals and chemicals. For the non-clinical carbon footprint, it's the things that you'd expect: staff travel, patient travel, gas, business services, electricity and goods. And if we just look at electricity, the top 3 are computers and monitors, 44%, fridges, 27%, people forget about fridges, and lighting, 14%. So we're going to have to apply the principles of sustainable healthcare, which are patient empowerment and self-care, prevention, lean service delivery, and low carbon alternatives. And anybody working in the health service realizes that all 4 of those can be really improved a lot. Because what we have to do is try to mitigate to reduce the emission of our greenhouse gases, but also adapt, because we are going to have impacts of climate change and we need to be able to adapt to them. So for mitigating, we need to do things like have a more renewable energy, invest in zero emission buildings, transition to net zero emissions, sustainable travel and transport, provide healthier, sustainable food, incentivize and produce low carbon pharmaceuticals, implement circular healthcare and sustainable healthcare management, and establish greater health system effectiveness. It's a great wish list. But it's all pretty well mapped out. We know what we need to do to try to achieve this. And as regards adaptation, we have to be prepared for the following. We're going to have more frequent and worse flooding. We're going to have risks to health from high temperature. We're going to have shortages in public water supply. We're going to have risks to our natural capital, risks to our domestic and international food production, and new and emerging pests and disease. And so we have to be ready to cope with these things. And if you just look at one of them, flooding, so as we already 7 to 8% of GP practices in the UK are already in flood zones or at risk of flooding, and 11 to 12% of hospitals are also at risk of flooding. This will get worse. So, how do we improve, protect planetary health? What can we do about it? Well, it helps to have relentless, stubborn optimism and avoid environmental grief, climate depression, eco-anxiety, futilitarianism, and just being a doomer. What can conditions do? Well, there are individual actions, which I'll briefly mention, and mostly it's our work-based actions I'm going to be talking about. So individual actions, you have to ask yourself, have you actually checked your carbon footprint? It's very easy to do. You can just Google it, look up for and find a way of doing it. And if you want more information about carbon and carbon literacy, see the www.ukhealthalliance.org /carbon literacy guide. And that will give you a good, simple, brief introduction to everything you need to know about carbon literacy. In carbon literacy, we talk an awful lot about tons of carbon dioxide, and if you want to know what that looks like in volume, it's roughly the same volume as a normal-sized hot air balloon, and 1 ton is roughly the same weight as an adult female giraffe, if that helps you. When we look at our work-based actions, 65% of the general practice carbon footprint is our medical treatments. And the single largest factor driving healthcare pollution is clinical care, and it's physicians' decisions accounting for 80% of everything that's spent. You can actually find the carbon footprint of any drug now with the free medicine carbon footprint formulary, and it will give you the per dose carbon footprints of medicines either as low, medium, high, and very high. So you can switch if there are equivalent medicines from very high carbon footprints to lower carbon footprint medicines, and that's a free tool. Other organisations like the RCGP and its net zero service gives a lot of support about things you can do to reduce your carbon footprint. And Greener Practice, which is the UK's primary care sustainability network, which I'll be talking about a little bit more, has got a lot more resources that you can actually look up, or human resources, people who are like-minded to help you achieve your lower carbon footprint and become more sustainable. And the other main organisation is the Centre for Sustainable Healthcare, which has been leading on this for about 15 years and is a major source of learning and education. And these are their principles: patient empowerment, prevention, lean service delivery, and low carbon alternatives. These will come up again and again and again and again. So let's start with some actions. In your work, find out what you need to do in your practice. Now you can do this by using the Green Impact for Health Toolkit. It's free. You should think about adding sustainability to the agenda of your meetings. And regarding your patients, really you should be sharing decision making and getting their informed consent. All the evidence shows that ACT actually gives better care. And always be asking yourself, is it good for the patient and is it good for the planet? If you add sustainability to the end of your meetings, then you'll be partly on the way to establishing a triple bottom line practice, which reports on the social, environmental and economic impacts and outcomes of what we do. We know that most practices now have increased their financial expertise, but we need to do the same with their environmental and their social impacts and outcomes. So you can be part of the solution, not just the problem. So we want to take action to avoid the unmanageable, that's mitigate, and action to manage the unavoidable, that's adapt. But how can you do more and spend more time with the patient when you have an increased workload, an ageing population, and greater multimorbidities, underinvestment in healthcare, particularly primary care, overloads of information regulation, constant technology developments, reorganisations yet again, and changes that undermine delivery of care, and still the aftermath of the pandemic. So the next step, start with the Green Impact for Health Toolkit. It's easy. So a little bit about that. We started it in 2014 when Bristol was Green Capital of Europe, and it's rolled out a couple of years after that nationally. It's supported by the Royal College of GPs, At the moment we've got over 1,600 practices who are registered using it. That's roughly 16% of all the general practices in the UK. What can the toolkit do for you? Well, it can advise you to make a practice more sustainable. It can save you money by consuming less and wasting less. It can share the work of doing this throughout the practice team, and it can spread the culture of sustainability to others, your staff, your patients, and the rest. And it can reward all your efforts with a Green Impact Award if that's what you want. Always remember that green practice is good practice when it's good for the patient and good for the planet. We're selling stuff which is good for the patient and good for the planet, not just good for the planet and bad for the patient. Good for the patient, good for the planet. So, this is a bit about how to use the Green Impact Health Toolkit. If you start on its sort of landing page, it looks a bit like this. And there is help and support down there at yellow arrow 1, which you can get. And if you're using it for the first time, you obviously need to register, that's yellow arrow 2. And then put in your email and your password. And for new users, you need a lead team member who registers and creates your team. And when you create your team, you need to identify it with a place descriptor. For example, Church Road Surgery, Bristol. That's really important for two reasons. One is there are a lot of Church Road surgeries around, and if you don't describe the one you're at, the rest of your team will end up registering with the wrong practice. This when they're trying to use the toolkit. And the other reason is we are developing it so that it's becoming more locality based, and integrated care boards or health boards will be able to help practices in their area actually achieve net zero carbon. So once you've registered, you can get your other team members to register and log in, and then they just choose the correct team from the drop down menu because you've said your Church Road Surgery, Bristol. Now these yellow arrows show that when you register you have a personal dashboard. This is personal to the particular user that is using it. That's arrow 4. And then on the personal dashboard you will get assigned actions. These are things which have been assigned to that person, or you'll get starred actions. Starred actions are assigned to everybody in the team. And then when you finish looking at the dashboard, you can click on number 6 and go to the toolkit. You can either do it through that or by looking on these categories where the bottom blue arrow is. So you can see that all the criteria, and there are about 125 of them, are made into these different sorts: carbon hotspots, cost hotspots, energy saving, food and drinks, governance, healthy planet, learning, new user and communication, prescribing, quality improvement, social prescribing, travel and exercise, vulnerable groups, waste and recycling, water, and zero carbon. So if you could click on that, it takes you immediately to those categories of things. And then if you look at the blue arrow at the top on the right, then there's a leaderboard for the other practices in this, the 1,600 of them, that shows how they're doing, amassing their particular points on their journey to become net zero carbon practices. Lower down the personal dashboard page, you can see how your particular practice is doing. We have various categories of criteria: bronze, silver, gold, platinum, and diamond. And these link into, similarly, bronze, silver, gold, platinum, diamond awards, depending on the number of points and the number of activities you've done. But it just shows this particular practice's progress with the various point system. So once you click onto the toolkit, this looks a bit like this. It shows you your team at the top, arrow 7. And then you can also search in different ways using 6 different filters to find the various things that you want. This one's just got carbon hotspots. So you put in carbon hotspots. A lot of them will be prescribing. And the first one is PRS001. And it's a carbon hotspot. It's a prescribing thing, and it's a bronze category. Looking at that in more detail, you can see the criteria. The action you have to take is the practice has reviewed its prescribing trends. It has either accessed its practice dashboard in England via open prescribing, or via a local preferred alternative like Eclipse, and someone in the practice receives regular email alerts on the prescribing trends. And the next tab shows you further information. The further information tells you why you should be doing it, and importantly, how to do it. So why? It's because optimization in prescribing medicine helps improve medicine safety and has the potential to save the NHS millions of pounds a year. We know that 10 to 20% of medicines that we prescribe are never used. And then it goes into detail about how you can do it actually in your practice. Now, about 10% of our practices apply for awards every year. in which case they will be audited. I won't go into the details of that, but the next tab shows how you will be audited. And if you are wanting to actually achieve and get points for this, you have to put in your own comments and evidence. And you can put that in as free text or attachments or even photographs. And then when you've completed the task, you can switch it to in progress or done. So the other thing that you need to know, as if you're a leader on this, is that if the hollow arrow on the top, the hollow star on the top yellow arrow, if you click on that, it will fill in the star, and then this task will be assigned to everybody's dashboard. Or you might think there's one or two particular people who need to be assigned to this task. It might be a clerical or it might be a clinical task. And if you assign it there, you can assign it, there's a drop-down menu of the number of the users of your team that are on the toolkit, and you can assign it to them. And then it will just pop up on that person's or those people's personal dashboards. So that's what it looks like. That's the filled in star, and then you can see it's been an assigned task. So overall, this is the Green Impact for Health report from December 2024, and you can see in this that 232 practices submitted for award, 37 practices achieved gold awards, 11 of the practices achieved platinum awards. No practice so far has been able to achieve diamond award. It's a journey from bronze through to silver to gold to platinum and then to eventually diamond. And coming soon to the toolkit, we're going to have a new dashboard on it for integrated care boards or primary care networks or other organisations above the single practice level, so that they can facilitate green actions in their practices. ICGP funding is guaranteed to keep the toolkit free for use for UK general practices until December 2028. There are many new low-carbon clinical pathways for clinicians coming from the new Green Practice platform that launches in May. I'll just say a little bit about that. This is coming in early May. It's replacing their current website, and it's really there to provide really off-the-shelf projects which practices can do with the minimal amount of effort to improve their sustainability. There'll be a library for projects and resources, and there'll be an improved network connections. You can see on the right, these were all the areas where there are currently Greener Practice Network members. And this is a summary for GP practices about why they want to get involved in using this new Greener Practice online resource. And this is the one that they prepared for ICBs on the basis that for £1 invested by an ICB, the ICB will get back £10 in savings if 75% of their practices do one of the projects per year. This is, a great deal of benefit for ICBs. The problem, of course, for practices is if we save money by prescribing less expensively or doing less referrals or whatever, the savings don't come to the practice, they go to the ICB. So this is a real reason why ICBs should invest for their practices. So, in summary, we want the Green Impact tool out there. It's helping to avoid the unmanageable and manage the unavoidable risks associated with climate change. We're giving Green Impact prescriptions, which gives people simple and relevant actions to take because it's good for them and it's good for the planet. Thank you.
That was fabulous, Terry. Thank you very, very much. Terry, do you want to pop your camera on? Fantastic.
Yeah, it's on, and the video's on, and the audio's on. Yep.
I think we've obviously spoken many times. You know how much of a fan, because this is very much that it's social actions and it's practical actions. I guess the first question the first thing I'm going to say is if anybody's got some questions, please pop them in the Q&A. But I've certainly got one. The Green Impact for Health Toolkit is particularly aimed at general practice. Is there, well, actually, thank you very much, David Easton. Is there an equivalent for secondary care, or I was about to ask, and other organisations. So I was thinking about the people who are interested in lifestyle medicine who are not necessarily GPs or working in the GP practice. So have you got any suggestions of where they may be able to get similar, easy to use, practical, social behaviour change projects?
Well, I'll just give you a brief history about Green Impact for the Green Impact process, which started around about 14, 15 years ago when it started by the National Union of Students. And they started off in student unions and they spread it to universities and they spread it to councils and then they spread it to hospitals next. So there's always been around about 10 to 12 hospital trusts in the UK using it at one time. Sometimes they pop into the scheme and out of the scheme. And so they develop a bespoke team for that particular organisation. So they exist. In Wales, they've got one which covers all of primary health, mostly to do with non-clinical actions. But in Wales, there's one there which is set up by Public Health Wales for everybody. And so if you're a big organisation like a hospital trust, then you can apply to the Green Impact organisers, which is now run not by National Union of Students, but a spin-off charity they set up called Students for Sustainability. And they're great partners to work with. And really, for relatively little money, you can, set up your own scheme and do it there. I mean, the dentists have set up one recently. And so there are always new schemes popping up and about, really. And in the meantime, if anybody wants to copy any of this stuff, then certainly if they email me, tjkemple@gmail.com. That's tjkemple@gmail.com. Then I'm happy to send you just an Excel spreadsheet of all the list of things that we've got, and then you can, cut and paste them into anything that might suit yourself. But clearly, in different organisations, there'll be different ways of doing them. But there is overlap for a lot of them.
I've put the link to the greenimpact.nus.org.uk into the chat, which is where there are the Green Impact for Health, Green Impact for Dentistry, public sector, businesses, arts, culture, heritage, a whole plethora of places available. I think the other in secondary care is that there are green plans being written, and they aren't quite the same as the Green Impact for Health Toolkit, but there are ways that secondary care can absolutely get involved. I think outside of primary care or secondary care, general practice and hospitals, there's likely to be other trainers and counsellors and link workers. And I think that I suspect that you would probably encourage them to become involved with whichever, if they are linked to a GP practice, to get involved through that as a mechanism.
Yeah, certainly. So there's two things there. One would be that if they're in general practices, then greener practice is the natural sort of home for everybody to get involved. That's a network of usually very helpful people who are in your area and are looking for sort of colleagues to peers to join them in actually making progress with these things. I mean, the bottom line is, I think, is if you're trying to change the world by yourself, it's completely impossible. So if you're in a practice, you actually need a team of people. And if you're in a practice with your team of people, actually you need to link up with other teams of people, because you don't all have to do it. You can work together and make great efforts, really. And in some of the areas where there has been some simple funding to promote practices in an area working like Gloucestershire, they came up with programs which really, one practice developed something and the others went along the same sort of route. I mean, training practices will be familiar with, stealing good ideas from other people, and just saves you a lot of time if you're in that sort of environment where you can just make progress because somebody else has done most of the work. And just repeating again, greener practices new platform where they're going to be all these off-the-shelf things, which are like an idiot's guide to doing everything. So you don't have to, you'll be able to import the searches from the scheme, so you don't have to think out how to do it yourself. And the basic message is that for sort of 10 hours work, you can actually do something really worthwhile, which will make a really big difference.
for me, it's that sort of social team. It's the collective. It's everybody playing a role and everybody having responsibility. That this just, whether we think about planetary health, lifestyle medicine, greener practice, it all encapsulates that same sort of ethos. There's a question from Charlotte Davies. Is the primary care greener toolkit just for use in English practices, or is Wales included too? And I'm actually going to extend that and say, what about Scotland and Northern Ireland? And I know that we've got a number of international colleagues watching live and watching on repeat. So just in terms of wider access, what might be available?
So the Green Impact for Health Toolkit for general practices is funded by the RCGP for all of the UK. So all UK practices, and there's very active members, particularly in Scotland and Wales, and a couple in Northern Ireland. But any UK general practice is welcome to join the toolkit for free. If you're in another country and you're interested in setting up schemes, then if you just want what the criteria are, then I'm happy to send that to you for free. The Green Impact team at SOS Students for Sustainability are international. They have run programs, particularly in the Netherlands, in Australia. So they will set that up for you. There is a charge associated with it, but it's a lot cheaper than doing it yourself. But if you just want the criteria and any information, then you've contacted me, and I'm happy to provide that for free.
I'm going to put the link to the background information about the Green Impact for Health in the chat. Terry, if you don't mind popping your email in as well, if you're happy to do so.
Yeah.
Because I think that this is one of these things which so many of us I think sometimes get stuck and not quite sure what to do or where to go or how to start or how to do something. And this really is that sort of plethora of ideas at our fingertips. So I'd like to say thank you very much to Terry, and I would like to introduce Ellen Devine, who is here smiling away at us, which is fantastic. And I think that you'll enjoy this one. So I'm going to hand over to Ellen, and the floor is yours.
Thank you. Can you see my screen sharing there? Just to confirm.
I can't. I can see
Not
you
yet. Okay,
at me.
let's try again.
Lovely.
There we go. Hopefully that's come through for you now. Yep. Brilliant. Okay, so thank you very much for inviting me to be part of this exciting conference. As Terry said, I'm Ellen, and I work for Forestry England as part of our national recreation team. And my role is all about connecting people with the health and wellbeing benefits of forests. So it's kind of the perfect role, really, and supporting everyone to feel good in the forest. And that's the topic of my talk today. So I'll be talking you through the wellbeing benefits of forests, our Feel Good in the Forest programme of activities for people with health conditions, and how we can help health professionals such as yourselves experience the wellbeing benefits of forests for yourself, as well as supporting your patients to do that. And then also our virtual forest resources, which will bring the forest to everyone wherever they are, including in healthcare settings. So first of all, who are Forestry England? Forestry England has been creating and caring for forests and woodlands for over 100 years now. We manage more trees and woodlands than any other land manager in England, and we manage these spaces for people, for wildlife, and for timber. They really are the nation's forests, and that's why we're so passionate about making sure that everyone can come and enjoy them. We firmly believe that forests save lives, and I hope through this presentation you'll come to agree with me too, and you'll come to want to celebrate, promote, and engage even more people with the health benefits of trees and woodlands. So on that last slide, I made a really big claim that forests save lives. So I better back that up now with some evidence. This slide includes figures from Forestry England's 2023 natural capital accounts, our visitor surveys, and the evaluation of a programme that we run called Active Forests, which we deliver in partnership with Sport England, and really does what it says on the tin. It's all about getting people active in forests. Some key figures on this slide to highlight highlight to you. We welcome 152 million active visits a year, with people visiting our forests to walk, run, cycle, and much more, increasing physical activity and generating those health benefits that more people leading more active lives brings for individuals, but also for communities and society as a whole. I slipped there through the slides there. I got excited. I'm delighted to say that 97% of our visitors say that their visit has had a positive impact on their physical and mental well-being, and that can be translated into a saving for the NHS of over £565 million in avoided treatment costs. So, really seeing forests as an important part of that preventative health, delivering activities that support people to stay healthy. We also work with amazing partners. I've mentioned Sport England, but we also work with Park Run, the Arts Council, community groups like This Girl Can, Flock Together, Muslim Runners, and many, many more to engage people from all walks of life with a range of interests, to bring them into forests so that they can enjoy those health benefits that time and connection with nature brings. So, how do forests help us feel good? Well, the simple truth is that trees lead to better human health. We know that time in and connection with nature improves mental and physical health, immune function, sleep, and even life expectancy. The key impacts of forests include improving the quality of the air that we breathe, encouraging us to do more physical exercise, and a reduction in serious health conditions, and that people who have access to green space report increased happiness and mental well-being. Studies have shown that exercising in forests provides a distraction from fatigue, making physical activity feel easier and more enjoyable, and keeping people active for longer and increasing their satisfaction compared to working out indoors. And I just have to think about the difference in terms of how I feel if I'm slogging away on a treadmill in a gym compared to how I'm feeling if I'm running through a forest environment. I know which one I feel benefits me more. There's also a really positive relationship between nature and our physical health. I mentioned the improvements that it has for our immune system, but then all those benefits that come from being physically active in nature, so improvements to our cardiovascular health and our weight, and interventions in nature that increase physical activity have been shown to be cost effective for the health system and beneficial to individuals and communities. At Forestry England sites, we have loads of ways that people can be active in a way that works for them. That might be joining a walking, running or running group. It might be coming on your own or with a friend or with families or with the dogs, and following a walking, running or cycling way-marked trail, or taking part in a class, something like a park run on a Saturday morning or a junior park run on a Sunday morning, a Ramblers Wellbeing Walk, or perhaps a Couch to 5K course. Being active anywhere is good for you, of course, but you get added benefits and added bonuses when you're active in a forest environment. Some of you may know already, but I think this is quite a cool fact. Trees release something called phytoncides, which are antimicrobial compounds. The trees release them to protect themselves against pathogens and disease, but when we breathe in those chemicals, they also help by improving our immune system by increasing the number of natural killer cells that we have. So just by sort of being around the trees and breathing in the air, we're getting some of those health benefits. We also know that being among trees helps to reduce stress, it improves mood, and it reduces the possibility of developing poor mental health. Forests provide that really gentle sensory stimulation, just enough to stop us ruminating on our to-do list or things that we're worried that we might have said wrong or done wrong in the past, but never in a sort of overstimulating way. They're kind of that soft stimulation, which contrasts a lot with a lot of environments we find ourselves in the modern world. Just think about your sort of hospital settings, or even sort of doing the weekly food shop at Tesco's. There's a lot of bright light and noise and distraction that can be overstimulating in those sorts of environments. And forests provide that kind of antidote to that space where we can go and just chill and be calm and stop and pause for a bit. We've recently launched wellbeing trails at over 20 of our sites that feature panels along a walking trail that encourage visitors to pause, reflect, notice, and connect with nature. And the feedback from those trails is that people really appreciate being given permission to slow down and to just notice what's going on around them, which I think really says something about how we live our lives day to day, where we don't take that time to just stop and pause and kind of notice what's going on for us, but also what's going on around us. And finally, forests are spaces that bring people together, whether that's families enjoying a Gruffalo trail or coming together for a picnic, or people joining an organised volunteering group to meet new people or learn new skills, or taking part in a wellbeing session that helps them create new friendships and forge new social networks. We really encourage tea and biscuits as part of lots of our activity sessions to really enhance that kind of social element. And people tell us that they definitely kind of keep coming back to take part in that physical activity or whatever it might be, because they value that connection with other people. On that note, Feel Good in the Forest is our programme of activities for people with mild to moderate health conditions. But really, it's more than just that. It's about creating healthy communities with people who are connected to their local spaces and really empowered to move, play, enjoy, connect in the ways that work for them. And we deliver Feel Good in the Forest in partnership with Sport England via National Lottery funding. Feel Good in the Forest is currently focused at 4 hub forests: Chopwell Woods and Gisborough Forest in the northeast, woodlands within the National Forest in the Midlands, and a collection of forests called Thames Chase Community Forests on the outskirts of London, as shown in the map on this slide. Our activities are all designed with and for local communities, with a focus on people, as I said before, with mild to moderate health conditions and those facing social isolation or feeling lonely, or just wanting to do something that will help them increase their confidence. We work really hard to reach groups who we've previously underserved in the natural environment sector, for example, global majority ethnic groups and people on lower incomes. And these people are also the groups of people who tend to have those poorer health outcomes. And yet we know they can experience the greatest benefits from the time in nature. The activities that are delivered as part of Feel Good in the Forest vary from your more traditional walking type groups to flamenco in the forest, which we've just launched at Chopwell Woods near Gateshead. I'm not sure flamenco has ever been done in a forest near Gateshead before, but we're going there. We've also got forest choirs, a forest church, we've walked alpacas. The wilder the better, but if people want to do it, then we'll create it. As well as the more active activities, we do things like nature journaling and forest bathing sessions to help people experience that more mindful connection with nature and with themselves, and also activities that help people build skills such as learning to ride a bike or learning to do a bit of map reading. The activities are all based on local community interests and assets, but they all aim to deliver our participant outcomes, which are shown in orange along the bottom of this slide. And those are to support people to be more active, to build their resilience and get that sense of restoration that we experience from time in forests, to feel that connection with other people and with the forest, and really importantly for us, for them to feel empowered, that they can try new things, they can go on to connect with nature and with physical activity and with other people beyond the lifespan of the programme, and that they always feel included in that forest environment, that it's a place they feel they belong and they can come back to. Core to our delivery model is supporting people to move from that more targeted, facilitated and supportive activity that's represented at the kind of top of this pyramid as the green care activity, down into the more mainstream regular activities at the forest, represented by the section in the middle, and that might be things like park run or a regular walking group. And then also to be able to experience the forest for their well-being in that more everyday self-led way. So for example, bringing the dog and going for a walk through the forest, or visiting with the family and enjoying some time spent together. Feel Good in the Forest really is ultimately about doing what it says on the tin, helping people feel good and enjoy the forest. And in doing so, we hope that we empower people and communities to feel motivated to lead healthy and active lives connected with nature. But don't just take my word for it. These are a few quotes from participants in Feel Good in the Forest. On the left-hand side, we have quotes from the people taking part in a Reading for Wellbeing walking group delivered by Forestry England with Gateshead Library at Chopwell Woods. The group listen to audiobooks on headphones while they walk through the forest, and they take time to stop and discuss what they've been listening to at various points around the forest. And as you can see in the photo, they also love getting up close and personal with trees and giving the trees a good hug, which has many health benefits too. And as the quotes show, the Reading for Wellbeing group motivates people to get out of the house and join in with activities when they wouldn't otherwise. They also create social connections with each other and a connection with the wood as a place that they associate with being happy, which is so important to us because we want people to have that space that they can always come back to whatever's going on in their lives. The quotes in the top right corner in the speech bubble is from Peter, who is part of our Woodland Warbler choir. So the choir gives Peter something to look forward to, and the group are often inspired by their natural surroundings, and that's what they like to sing about, and they enjoy walking around the woods as well as taking part in the choir. And finally, the bottom right quote is from a participant in our Love and Loss walk. This is a walk that's led by a walk leader and a grief counsellor. People can join the walk and they can talk or they can not talk. They can share with other people who have experienced bereavement like they have. They can talk one-to-one or in a bigger group with the bereavement counsellor. And the feedback that we're getting is that a lot of people just didn't feel comfortable going and sitting in a room in a circle and talking in that environment, but actually the sort of being able to come out into the space of the forest and drop into the conversations as they feel able to is really helpful. And also there's something about nature that just lends itself to talking about life cycles and new growth and things ending. We'd love to do more of those sorts of activities pairing up with health professionals. We've recently just started delivering a menopause walking group where a GP who's an expert in supporting people going through perimenopause leads the walking group, and women can come along to that. So rather than just telling women to do physical activity, that's actually kind of part of the education is taking place whilst you're doing that walk in nature. So I promised you that I'd talk a bit about Feel Good in the Forest and what we've got available for you as health professionals. We have this Feel Good in the Forest e-learning module, which we've recently launched. It's very short, it's interactive, can be completed in under an hour, and it will help you understand in a bit more detail the health and wellbeing benefits of nature and forests, and it has all the references to the sort of research that I've loosely alluded to in this presentation. It also will help you understand how you can support people you work with to access nature, and shares some resources that will help you bring nature into your settings. We can also offer at some of our forests across England in-person wellbeing days for health professionals in the forest. These days are designed for an opportunity for you to network with colleagues in a very different environment, but also experience some of those health benefits for yourself. And in a recent survey that we did with health professionals who had come on these wellbeing days in our forests, 82% of the participants reported improved health and wellbeing for themselves on the day. 91% felt motivated to use their new skills, knowledge and understanding with patients, and 100% thought that referring patients to go for a walk or take part in an activity at a Forestry England site would be really beneficial for them. So that's been great to be able to deliver some of those days. We know, however, that not everyone can get to the forest all of the time. I'd love to be out in the forest all the time, but even though I have an amazing job, I spend a lot of time sat looking at screens and working in that sort of environment. So whether it's that you're ill or you've got a lack of transport and you don't live near a green space or you're just super, super busy, sometimes we need ways that we can bring nature into our day-to-day life. Over the past few years, I've spent quite a lot of time as an inpatient in hospital, having a ridiculous amount of bowel surgery. And I've always really struggled when I've been in that clinical environment because it's very noisy and bright and there's so much going on. And sometimes you're in a bay or a ward that doesn't have any windows or access to nature. So during one admission, I dreamed of creating a hub of virtual resources that could bring nature to people, even in a hospital bed. And that's where this virtual forest hub that we've created sort of came from. The virtual forest hub is available on our website and it has links to videos, some of them 360-degree videos of forests through all the different seasons. It's got some audio meditation recordings, it's got some podcasts, creative activities, even a yoga session filmed in a forest which you can follow along to, so that people can access a bit of those nature benefits wherever they are. And there has been research to show that even that sort of virtual nature experience, even just seeing images of nature, can help improve people's recovery rates. The poster that's featured on this page is available to download from that website. If you are working in a hospital or a primary care setting or anywhere where you think people might benefit from just a few moments escaping into a virtual forest, please do download and display that poster. If people scan the QR code in the corner of the poster, that will take them straight to those forest wellbeing videos that I mentioned. So perfect for staff rooms, waiting areas, anywhere where people might just be sitting feeling a bit stressed out and might want a little bit of a moment to escape and relax in nature. Before I finish today and give you my contact details, I'd like you just to take a few moments to think of make two little promises or pledges for me. So hopefully you've seen some beautiful images of forests through this presentation, and hopefully I've kind of inspired you to even more want to get outside, or maybe you did get outside in your lunch break. But as a little promise for yourself, I'd like you to think about one thing that you will do today to connect with nature. And that could be that you can get outside and listen to some of this conference outside, or maybe after you've finished this, you can do that. Or it might be that you can look out of a window and see what the clouds are doing in the sky, or water a pot plant around you. And then the second one, which might take a little bit more thought or a bit of time to deliver, one thing you can do this year to help someone else connect with nature. That might be a family member or a friend, or perhaps it's a patient or someone you're working with, or perhaps it's a colleague. And I know that I've been inspired by lots of the talks today, so I'm sure you've got lots of actions that you can take away. We would love to see you in a forest soon. If you just Google Forestry England, you'll be taken to our main website page where you can type in your postcode, and that will bring you up a list and a map of all of your nearest forests. We've got 1,500 forests and woodlands. I don't know them all off by heart, but if you have a look, hopefully you'll find one that's really close to you. If you're interested in the Feel Good in the Forest programme and you'd like to refer people you're supporting to that programme, then if you go to our website, you've got the top URL here, so /feelgood, and you'll be able to get more details about that. And if you'd like more information more generally on the wellbeing benefits of forests, then go to our website and you /wellbeing, and you'll find everything there. As you might have guessed, I love chatting about forests and nature and wellbeing. So if there's anything you think I might be able to help with, then please do get in touch, and my email address is on the page, on the slide there. Thank you very much for your time. I hope I see you in a forest sometime soon. And now I will attempt to work out how to unshare my slide. And then if there's any questions, I'd be delighted to answer them.
Thank you, Ellen. That was an amazing talk. Flamenco in the forest.
Yeah, I know.
This is fantastic. This is perhaps taking us more back to our roots, is it? To how our lifestyle might have been living in a forest, and a little bit of paganism. It feels quite nice, doesn't it? We have got a couple of questions for you actually in the chat. And one is, could you clarify the names of the chemicals that the trees are giving out that bring all those wonderful health benefits?
Yeah, phytoncides. So yeah, I can put in the chat a link to some more information about that. I'll do that straight after.
Fantastic. And are there plans to extend any of the programs to other regions?
Yeah.
Or can you travel to go and join one of these groups if you live outside a region where it's provided?
Yeah, so Feel Good in the Forest is provided at those 4 sites that I mentioned. We would love to expand to more sites, funding dependent, so that we can provide those activities. So that is in the sort of long-term plan. Like I said, though, we do have 1,500 forests and woodlands across the country, and it might be that even if we haven't got our formalised Feel Good in the Forest programme happening at a site near you, we may have activities that are taking place through third-party providers. So perhaps Ramblers Wellbeing Walks, Couch to 5K groups, bushcraft for wellbeing sessions, a whole range of activities. So if people want to get in touch with me and just let me know where in the country you're based, I can do a bit of research and find out what's local to you. And in terms of the health professional events, we're able to offer them across England, depending on where we've got sites and forests. So if it was more kind of bringing your colleagues out to a forest that you were interested in, then yeah, get in touch with me and we can try and see where your nearest forest is.
Thank you. And I know there's some initiatives to give trees to hospitals, where hospitals have land where they can plant trees. Any chance of getting trees into hospitals, you think, like they have in those big hotels?
Well, you say that. So I was a patient, I mentioned I was an inpatient, and that was at Southmead Hospital, which is in Bristol. And Southmead Hospital is a fairly new hospital. I think it's about 10 years old, but they do have trees inside in the main atrium. And that was amazing as a patient, because it meant that even when I was hooked up to drug stands and things, I could kind of get off the ward and down into the main atrium and have that sort of experience of having trees around me. So yeah, I think there are some great examples. I know there's also a mental health unit being developed on the outskirts of Bristol, where all of the entire building is being built to be so that all the rooms have views of courtyards and the patients have spaces to access nature. So yeah, definitely. I think there's huge potential, and I think it would make a real difference. And I can see one of the questions is around the poster. Can it be printed wall size? You can print it whatever size you want to print it. If you wanted to talk about doing a more wall size mural version, then again, get in touch with me. I can get our design team to make sure that the graphics are big enough for you. I know, again, Southmead Hospital, the ward I was on, there were a couple of very depressing rooms with no natural light, and the nurses commented while I was a patient that they never leave patients in those rooms very long because they deteriorate. And we were chatting about sort of the benefits of having a window and looking out into nature, and they've just secured some funding to create like tree murals along the walls of those depressing rooms. So yeah, definitely sort of appetite to do that. And I know we've worked with a couple of hospices looking at how they use VR headsets with patients receiving end-of-life care, so they can use the 360-degree forest videos to really sort of give that nature experience to people who can no longer sort of get outside. So there's loads of opportunity, and if there are healthcare professionals or services that are interested and they think we might be able to support with resources that we've got or creating new resources, then really open for those conversations, and I'd love to be part of that.
Yeah, I mean, there are studies that show that patients get better more quickly if they've had a view of trees and green space. And we have actually, in fact, just where I work in an urgent treatment centre, we're in the basement. I got some funding for digital windows. So you can dial up a forest, or you can dial up an ocean, and it's supposed to be all sort of correct season and time of the day. So you get the right lighting, the right amount of sunshine. People mainly want to watch the football on the screens, but as a therapeutic aid, it can work very well. Yeah. Even having pictures of trees, posters of trees, calms people down and makes a big difference to therapeutic outcomes and to recovery times. So hopefully, if we get a hospital or a practice full of pictures of lovely trees, or indeed some plants or some trees, the patients will get better more quickly and there'll be less pressure on our system.
Yeah. And it's got to have benefits for the people working in those settings as well. I remember talking to some junior doctors who were working on intensive care wards, and they were saying, why do they always put the intensive care wards in the darkest part of the hospital? I miss seeing the sun. And actually, you know, if you're working in those environments, having access to nature has got to make you feel better and happier, which is better for you and better for your patients.
I've got one question for you. If you could have one tree outside your door or in your garden or on your patio, what tree is the best tree for your health?
I don't know if this is this isn't a scientific answer at all. I'm sure there is a scientific answer. For me, it would be a beautiful oak tree that I have walked past since I was a child, and I return to walk past that tree often. I'm lucky to still live in the area I grew up in, and I think it's just that constant continuity of having seen that tree grow over the years. And a few years ago it got struck by lightning and it lost sort of a whole limb of the tree, and that was the same year that I ended up in hospital and I lost my large intestine. And I feel like the two of us are connected somehow, but the tree is now thriving. I saw it the other day, it's got leaves growing on it and it's doing just fine with a big chunk cut out of it, and I like to think that maybe I'll do as well as it's doing. So that would be the tree for me.
You're looking very healthy, I have to say.
Thank you.
Right, thank you very much again. We're coming up for a break. We're a couple of minutes early, but I don't suppose that's a problem, is it, Matt?
I think there's just one question two questions in the chat, in the Q&A. One about is Forestry Scotland and Wales doing something similar? Go on.
Yes, yeah. In Scotland, they ran a brilliant program called Branching Out, which I'm just gutted I didn't come up with the pun of calling a health and wellbeing and confidence building program Branching Out. But yes, if you contact them locally in Scotland, then there's a similar project. I'm not sure about Natural Resources Wales, which is like our equivalent in Wales, but I can have a look and try and find out if someone wants to get in touch with me with any specifics.
I think all you need to do is just have a lot of dad jokes, because then you can just say, we'll leave it alone.
Oh, nice.
Ask a dad. They will come up with so many puns for you. It is ridiculous. And the second question was about experience of moss walls. And I was actually going to extend that and say vertical walls. And do Forestry England sell any vertical wall or moss wall kits? So you can instantly install them.
We don't, but I love that as an idea. And if anyone knows of organisations that do sell them, then I'd love to hear more about it so that we can share them. Someone mentioned earlier the Centre of Sustainable Healthcare, and I think they'd be a brilliant organisation to get in touch with around how you can green the NHS estate. So they might have some contacts that they know about.
Wonderful. Thank you. Back to yourself, Maria.
That's it. I think we're just perfectly timed to have our break now for 10 minutes. I'm going to have a bit of movement and a cup of tea or something. No tea bags, remember. Just the leaves, avoid the plastic, and we'll see you back here at 14:55. I've got that right.
Welcome back, everyone. Just before we ask our next speaker, it's just a reminder that there is a link in the chat for a survey form. We, as you can probably tell, really are keen and passionate about planetary health and the overlap with lifestyle medicine. There is a Survey Monkey form in the chat for feedback. We want to make your lives as easy and as rich and as fulfilling and as interesting as possible. So please click on the Survey Monkey form. Let us know, let British Society of Lifestyle Medicine know what you think, what we can do in the future. So without further ado, we are at 2:55. I'm going to hand over to Elaine and for her presentation, Energy, Food, Climate Change and Health. Can't wait. Looking forward to it. We'll see you for questions afterwards. Elaine, over to you.
My name is Elaine Mulcahy, and I'm the Director of the UK Health Alliance on Climate Change. My talk today is going to look at energy systems, food systems, some of the main driving forces of greenhouse gas emissions, and how these things are connected to health. So first, a little bit about who we are. So the UK Health Alliance on Climate Change is an alliance of health organisations across the UK. This slide here gives you an idea of the types of organisations that are members of the alliance. So lots of associations, societies and royal colleges representing health professionals. The British Medical Association, the British Dental Association, the BMJ and the Lancet are also members, as is the British Society of Lifestyle Medicine. We estimate that the total membership of all of our members comes to about 1 million health professionals, so most of the NHS workforce. And the work that we do has got 3 main strands. First is increasing knowledge and understanding of the links between climate change, nature loss and health. The second is empowering health professionals and health organisations to advocate for just responses to climate change. And the third is using our influence to encourage policymakers to implement policies that protect and promote public health from the impacts of climate change and greenhouse gases. And one way that we achieve this is by producing evidence of the links between greenhouse gases, climate change, nature loss and health, and then presenting better alternatives that will both help to mitigate the effects of climate change and also bring benefits for human health. And lifestyle medicine touches on so many aspects of that. So today I'm going to focus on 2 different areas. The first is fossil fuels and the transition to green energy, and the second is food systems and sustainable diets. So firstly, we will have a look at energy and our current dependence on fossil fuels for powering our way of life. So we've been using fossil fuels for about 170 years. I'm talking oil, gas and coal predominantly. Our society, our life has been built up around them. So we can't switch everything off straight away, but we do know that greenhouse gases produced from the burning of these fossil fuels is the primary driver of the climate crisis that we are seeing now. And we've known this for a very long time, but we've been very slow to act. It was actually about 40 years ago, in 1988, when the first international agreement to reduce carbon dioxide emissions from burning fossil fuels was made. And the target agreed at that meeting was to reduce emissions by 20% by 2005. But this graph shows what's happened. Rather than reducing by 20%, 20 years after that 2005 target, greenhouse gas emissions are now 60% higher than they were when the agreement was reached in 1988. And look at what this has done to global temperatures. So here you can see there around 88, we were sitting about 0.5 of a degree above pre-industrial levels. And now we are, 2024 exceeded 1.5. It was the hottest year ever recorded. And 2023 was the hottest year before then. So this trend to hotter and hotter years is not shifting, and it will not shift until we start to reduce our use of fossil fuels. This is what the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, has to say about it. He says the modern addiction to fossil fuels is not just an act of environmental vandalism. From the health perspective, it is an act of self-sabotage. And here is why. So this graphic here is one that we produced when we looked at the ways in which fossil fuels harm health and the consequences of this. So if we look at heat, we saw in the UK in 2022, during the heat waves, over 8 weeks of heat waves in England and Wales, there were 3,000 excess deaths in the UK. Pollution is associated with about 30,000 deaths every year in the UK. Extreme weather events such as wildfires, storms and flooding are causing physical and mental trauma and also impacting on health service delivery. Also see harm to the natural environment, which has multiple knock-on effects for health, limiting the ability to remove carbon dioxide, polluting waterways, and impacting on food supplies. Our homes are so heavily dependent on oil and gas for heating, and this is driving fuel poverty, and they're also really poorly insulated. And our dependency on motorised transport is both increasing pollution and reducing physical activity levels. And none of these things are individually, or all of these things are individually or collectively linked to poor health outcomes. This includes non-communicable diseases, infectious diseases, poor mental health, food and water security. And this is the world we kind of want to work toward. This is the better alternative and the vision for the future, transitioning to green energy. And we believe this will also bring some health benefits. So switching our energy from fossil fuels to renewables will make the air cleaner, less pollution. Renewables are cheaper, and so there's greater energy security. There's opportunities for massive job creation through developing the grid, installing green energy systems such as heat pumps and solar panels, and many of these are local jobs. Switching to active travel and public transport will reduce the number of cars on the roads, and protecting green spaces will enable people to move through urban environments surrounded by nature. And this will bring multiple health benefits, improved physical activity that we'll see through active travel, for example, better mental health outcomes with greater access to green spaces and people being outdoors more, reduced disease risk, food and water security, and with that, fewer hospital admissions. So this is the future we need to work towards, and it is achievable. I'm going to go on now to the food system. So this slide here kind of lays out some of the environmental harms of our current food system. So the food system is responsible overall for 34% of greenhouse gas emissions, and it's also the main cause of biodiversity loss, accounting for about 80% of land use change around the world. Of all of the habitable land on Earth, 50% is used for agriculture. And we also know that animals eat more food than the amount of calories and proteins they produce. So farm animals and the crops that we use to feed those farm animals makes up 70% of the total agricultural land, but it only supplies 18% of our calories and 37% of our proteins. And then when we look at plant-based proteins, they produce a lot less greenhouse gases and use 150 times less land than a similar amount of beef, for example. This chart is one that we produced when we looked at the food sector, specifically in the UK. Now, this is specifically looking at food that's produced in the UK as opposed to imported. And the food sector, we found, is responsible for 11% of greenhouse gas emissions. And of this, 70% is from the production of meat and dairy. Current food systems are a primary driver of biodiversity loss due to large-scale deforestation and land use changes. And we also see that the use of fertilizers, pesticides are leading to pollution of water bodies. And the UK is one of the most nature-depleted countries in the world and has the most polluted water bodies in Europe. Food production contributes to air pollution, including ammonia and nitrogen, and up to 30% of air pollution in UK cities comes from farming, and most of this is from animal agriculture. We see overuse of antibiotics to control diseases in farm animals is leading to growing antimicrobial resistance, and the leakage of antimicrobials into the environment is also very polluting. And there's a health cost to all of this. So this slide comes from the Lancet Countdown on Climate Change and Health report, and it shows the increase in emissions from agriculture over the last 20 years and how this is impacting on health. So 12.2 million deaths globally and 112,000 in the UK that could be countered by balanced low carbon diets. Excessive consumption of diets rich in red meat, especially processed meat, is associated with an increased risk of type 2 diabetes, cardiovascular diseases, dementia, and several cancers. The World Health Organization actually classifies processed meat as a grade 1 carcinogen. That's the same level as tobacco and asbestos. And red meat is classed as a group 2A carcinogen. The UK government recommends that we limit red meat consumption to no more than 70 grams a day. But what we find is that in the UK, the average person is currently consuming twice that amount. And we look at plant-based foods, they're low in saturated fat, they do not contain cholesterol, and are a source of fibre that can lower the risk of heart disease, stroke, type 2 diabetes, and bowel cancer. And in the UK, people don't get enough fibre. So there's a clear, obvious transition there: less meat, more plants. So what we eat really matters. What we buy but we don't eat really matters. And this slide shows the different greenhouse gas emissions from different types of diets and the proportion that comes from the different foods that make up that diet. And there's a lot of variation in this. So you see the chart on the left, the top line is the average UK diet, the bottom line is the vegan diet. And there's a lot of options in between. So changing food doesn't need to be drastic from one to the other, but any consumption, any reduction in consumption of meat and dairy gradually will make a big difference. And this is something that we can all do, and that we can recommend or suggest to patients with the purpose of improving their health, but also reducing their greenhouse gas emissions. And if enough people do start to see this change, it will be really significant. In the UK, the Climate Change Committee, which advises the government, recommends that everyone should reduce their dairy consumption by 20% and their meat consumption by 25% over the next 10 years. So by 2035, we should all be eating a quarter less meat, at least, than we are now. And the reduction in red meat is significantly more. It's about 40%. It's worth mentioning here that there's a huge opportunity that comes with the food system. Two of the main greenhouse gas emissions produced from food production are methane and nitrous oxide, and both have relatively short lives, meaning they stay in the atmosphere for 9 to 12 years for methane and 115 years for nitrous oxide, whereas carbon dioxide will remain for thousands of years. And 32% of emissions come from the digestive processes of manure of cattle and sheep and goats. Methane is responsible for 30% of the total temperature rises that we're seeing today. So if we could rapidly reduce our emissions from agriculture, it would have an immediate effect on emissions and global heating. The reality is that currently we're producing a lot of food, but we're wasting it. So even the emissions we are producing, they're wasteful. Globally, we produce enough food to feed 1.5 times the world's population, and about 1.3 billion tons of food is wasted every year. Food waste accounts for 50% of greenhouse gas emissions from the food sector. Meat and dairy products account for 73.4% of all food waste related emissions. So if everyone cut their meat consumption and their food waste by 50%, we would see global food waste emissions reducing by 43%. So it's really significant, the impact that this could have. And I think it's underestimated. And again, this would bring significant benefits for health. It would reduce the number of people falling ill as a consequence of poor diet. And modelling studies have found that if everyone switched to a meat-free lunch 5 days a week, it would save the NHS about 2.2 billion a year through improved health outcomes. And this is equivalent to the salaries of almost 60,000 resident doctors. And on that note, I will finish. So thank you for listening. That's the end of my slide. Thank you.
That was absolutely wonderful. Really, really powerful and really insightful. Great to have you here with us at the moment. I was just going to make a couple of observations, and then we've got a question, and then if other people have got questions, please add them to the chat as well. I think one of the things that that has come out in a number of themes has been about that progressive change. It's not about the binary 0, 1, do nothing, do everything, but it's those gradual progressive changes of change one meal, change one day's meal, change 1 week's meal, so that actually it's the doing a little bit more than we did before. I've got a question, and then but I'm going to have a look at the question that's in the chat at the moment, or the comment that's in the chat. So many vegan products are now processed, e.g. vegan butter and cheese. So these have a carbon footprint. Man has been using dairy for centuries. There isn't a question with that, but I think it probably just raises a couple of issues, and thought you might like to comment.
Yeah, thanks. Yeah, it's a really good question, and I don't have the total answer. I mean, as with everything, I mean, there's processed vegan food, and there's food like beans and pulses and vegetables and whole grains and things that are not processed as well. And I think with any diet, it's the transition, and it's the looking for the healthier alternative always. Although saying that, I mean, I don't have the numbers to hand, but I know from evidence and speaking to people, and if there's anybody here from plant-based health professionals, they'll be more expert than me in this, that even looking at processed plant-based, like meat alternatives and things, that the footprint of them does tend to be lower, and than other kind of meat alternatives. But it depends on what you're buying and where it's coming from. So I'd say always aiming for the more natural the food is, the better in every case.
I think it's also that, one of the arguments that we hear is, but we used to do things like that. But 500 years ago, we had dairy, and that's true. But when we start looking at the growth of the livestock sector, and it's now 14% of greenhouse gas emissions globally, when we look at the amount of weight of livestock, that mankind has got something like, humans have got something like 300 billion kilos worth of mass. Animals are now 1,000, about 3 times that. And so actually it's not just, are we using a little bit of dairy, but it's the volume and it's the amount that we're creating as well that I think is sometimes not taken into account. One of the things that you mentioned was about raising awareness. What do you think the most effective method of raising awareness of the health benefits of a clean energy system are? Donald Trump this lunchtime has introduced tariffs on solar panels of 3,481%. I mean, 3,480% is obviously not enough, so you have to go 1% higher. So how do we convince people of the health and societal benefits of clean energy when we're pushing against some of these other forces?
Yeah, thanks. And with Trump and the tariffs, I mean, China is the global producer of solar at the moment, and this is about that trade war that's going on there. So in terms of energy, particularly with the green energy transition, the benefits for health are so massively significant, and so in terms of raising awareness, so first I would say is the health harms of the current energy system, and there are multiple harms of this reliance that we have on fossil fuels through the pollution, the impact that has on air quality, of the volatility of oil and gas prices, and that's driving the insecurity that we see in terms of fuel poverty. And at every stage of the fossil fuel production process, there are harms to health. And there's loads of evidence about that out there. But it's really important for us as health professionals to be promoting the positive message of the health benefits that are coming from the transition. And so there's security in solar panel roofs and having some your own power generation, in the cleanness of the air from producing renewable energies like wind, solar, things coming naturally from the Earth's systems rather than pulling fossils up out of the ground to fuel ourselves. And also then the knock-on effect of this transition, so reducing reliance on cars, for example, that are driven by petrol and diesel, and improving access for active travel and things like this will all bring massive benefits for health. And so I think it's communicating that message and building up knowledge and being able to communicate the message. And there's lots of information out there.
So might I suggest that there were three things? One would be a personal thing. We can change our own electrical tariff. We can decarbonize our own our own energy needs, whether they be gas heating in the home or fossil fuels in vehicles. We can do our little bit. And then we've got a professional bit that, for example, those who work in general practice can look to change the tariff of their practice, of their organisation. And then there's bigger sort of societal things where we can start lobbying for stopping oil and gas exploration at Rosebank, for example, about writing letters of support for the local solar farm or the local wind farm that is being proposed, because otherwise we only get to hear those negative, not in my backyard sort of voices. So it sounds like we could almost do a personal thing, a professional thing, and a public spirited population thing. Would that be a fair?
Yeah, I would agree with that. And I think there's so much we can all do as individuals, but it is limited because it is systemic change that's needed. It needs that bigger change at government level. But the more we're doing on a personal level, like driving less, a lot of people, we've become used to the car as the first. Well, for many people, the car is your first mode of transport, but actually using the car as a last resort, for example, and changing our diets. And there's definitely things we can all do. And we all have the power to influence as well. And politicians, our local politicians, they respond to votes. That's ultimately they want to win votes. And so making sure your local MP, whatever party they are, or if there's elections or campaigns coming up, making them aware of your position as one of their constituents. And the more we can get talking about that. And I also think as well, like in places like schools, any community opportunities there are to speak to people and get that kind of mass movement going, I think is really important. But ultimately, it is that bigger systemic change that's needed. And as health professionals, and this is one thing that we do a lot of at the UK Health Alliance, is getting that collective voice of getting signatures across all organisations that are members of the Alliance in writing to government ministers to demonstrate that that action, that want, that need from groups like health professionals for the change that's needed. There's actually a petition tomorrow that's going to be delivered to the government about Rosebank, and it's after collecting 1 million signatures for no new oil and gas. 1 million signatures, and it's going to be delivered to the government tomorrow. So that's incredible. That's an incredible response for that.
If I just make a plug for UK HACC, I think that over the next year or two, you're going to be producing some how-to guides for people, for example, on sustainable travel. I say this because I think I might be involved in writing it, stroke may have already written it for you. But one of the examples is if we want people to walk and to cycle and to use public transport, it's about how we frame that on our websites. So, for example, if it's on a surgery website, this is how you drive here, this is how you park a car here, and don't mention anything else. We're saying that most people drive here, but actually if we can change that and say the nearest bus stop is here, the length of time it takes to walk from the town centre to the practice is this long, we can start to reframe some of that and give people those tools to be able to say, actually, I don't need to use my car. I don't need to drive a fossil fuel burning vehicle as often, because the alternatives have been presented to me, so I can actually see them and I can make use of them when I now need to travel to destination A, B or C. So I think that we have got a role in our professional lives to be able to enable people to make the default choice, the right choice when it comes to travel, when it comes to diet, when it comes to energy use.
I agree. And actually, I think making it just it's making these things the norm is really important as well, and the acceptability of it and talking about it. And I've certainly seen there's been a few conferences I've gone to recently, and some of them you'll get information on how to get there, and it will be, like you say, very here's the where to park your car. But there was one I went to recently. It was the Royal College of Pediatrics and Child Health, actually, and the information on getting there, it was all about the sustainable options first. And they made the point, even in their communication, to say, we're really encouraging sustainable travel and stuff. Even them saying it was important. And the how to get there. And then the other part of it is food that's being served at events. And I think I feel quite strongly that health organizations have got a responsibility in the catering they're providing at their events and in their centers to be really healthy, sustainable, and to be demonstrating that leadership. I think that's really, really important.
I absolutely think that is spot on, and I think that anytime any of the audience are going to go to an event, I think that it is beholden upon us to write and say, are there vegetarian options? Are there vegan options? Are there only vegetarian options? So not just are they available, but maybe going a step further and saying, I don't know, and I might be speaking a little bit out of turn here, but for the British Society of Lifestyle Medicine conference in September in Brighton, I kind of hope that it's a plant-based menu. I'm not involved in any of that, but I think that organisations who are part of UK Hack are part of that network of organisations who are saying, we do want to look after health of people, populations and planet simultaneously. And this is where the overlap occurs, that we know that people's health gets worse, we know that population health gets worse, and we know planetary health gets worse if we have a high meat diet. So actually, we're going to do the opposite, and we're going to have the default, the standard, the normal of course it's plant-based. Well, why wouldn't it be?
Exactly. I totally agree. And it's really important that organizations like the British Society of Lifestyle Medicine are leading the way in that, because others will follow. And it is normalizing it. Like at the moment, it's normal for meat to be provided, and it's unusual for it not to be provided. But actually, by not providing meat and having a plant-based and people having to request meat, it does flip it on its head, and it makes people think, and that's really, really important.
I think that we might have triggered some comments in the chat about plant-based options only. So not just are they available, but anyway, I will. I may have overstepped my mark in terms of politics here, but we'll just brush over that for the time being. But maybe that's just chair's privilege for the day. So I'd like to say, unless you've got another comment, I'd like to say thank you very much to you, Elaine. And it was absolutely inspiring as ever, and it's always great to be able to hear you speak. And I'm going to pass over to our penultimate speaker today, who is Paula Bright. So hopefully we have got Paula, and the floor is yours.
Okay, hello, my name's Paula Bright. Thank you for having me today. I'm really grateful for the opportunity to speak. Dr. Matt Sawyer spoke to me a couple of weeks ago and was helping me work out where to pitch this talk. And he told me that no one will know my journey and how I became to be a sustainable physio. So hence, this is going to be part of my talk today. So the themes: therapy profession, how it's inherently sustainable. My journey to becoming a whole person physio, to becoming a whole planet physio. And the theme of interconnectedness. I'm a very visual learner. And as we all know, that even the pillars of lifestyle medicine can be hard to articulate and how intricately connected it all is. So I'm going to explain how I have come to view these difficult topics and have helped have systems that have helped my practice. And then finally, inspiration, hopefully inspiration, bold next steps via methods that have helped me along the way. So this is a little video of where I live, which is in Perranporth in Cornwall, I'm very lucky to live and practice right near the beach here. And I wanted to start by sharing this simple thought that I think has guided my career, but initially I didn't realise it, that healing isn't just about one person, it's relational. Between bodily systems, between people, and ultimately between us and the planet we live on. Everything is connected. And as you'll see from this video, lots of people here I know from my community, old, young, fitter, unfitter, people who are used to going to the sea every day, and people who do it on this annual occasion on a Boxing Day. But what I love is this sense of community, embracing our natural environment and the sea around us. And there's a real camaraderie that chivies everyone along to join in. And this is really my passion and what it's all about, my why, if you like. And using our environment, you know, on a day like you can see in this video, there's not many big waves, but for people who don't go in very often, the context of that environment could be hugely threatening. The cold temperatures, the losing your balance, and also in terms of environment, going in the sea, more and more nowadays, we have to avoid it because of the release of sewage. So this is a very personal video to me and really exemplifies what it's all about and seeking joy with our community in movement in nature. But don't get me wrong, there are lots of people within my town and every town and in many pockets over Cornwall that are lonely and struggling and having to use community kitchens and have lots of barriers to being active. So this is where we need to make changes to address all these crises. So physiotherapy as a sustainable health practice. I'm biased, of course. So inherently, physiotherapy in its very nature is sustainable. We rehabilitate people. We have the time to talk about their lifestyle and prevent ill health in all of the specialisms, musculoskeletal, which is mine, neurology, pediatrics, elder care, respiratory, rheumatology, etc. And the Chartered Society of Physiotherapy clearly recognises that healthcare needs to be effective and sustainable in order to tackle these growing health inequalities, and that physiotherapy needs to be at the heart of that. There is still probably a vital connection to be made, however, of recognising that the health crisis is a climate crisis and we can't address one without working to address the other at the same time. So this is why a group of physios and associates and physio students, united by this awareness, lobbied the CSP to declare a physio emergency back in 2021 after COP26. And why now a group of us are working with the CSP to create an environmental physio network to really ensure that sustainability is at the heart of our undergraduate training and in all our clinical practice, decision-making, investment decisions and communications within our profession and with the public. And that's a work in progress. It's currently going through the ratification process. But as a community, I feel we have the lead on low carbon whole person care. But that's me on my soapbox. Back to my personal journey. So when I was a green physio for other reasons at the beginning of my career 24 years ago, naive, you might recognise this blind men and an elephant parable, where when we look at something with a limited scope of vision, we can easily misidentify what's going on in the bigger picture. And this is very much how I felt when I was fresh out of university, doing all my special tests and using all my skills to look at a specific area that had been highlighted to me in a referral. And after I'd done all my junior rotations, I went to work in New Zealand as an MSK physio and was lucky enough to work in a rural community by the sea and really learn what it was like to be a valued part of a community in getting people moving and collaborating with sports teams and gyms and community initiatives. And when I returned to the UK, I quickly found and felt like a bit of a square peg in a round hole. When asked in appraisals what joint I wanted to specialise in, I would routinely say, I want to specialise in the whole person. But there wasn't really a career progression avenue in the whole person, unless it was managing people. With building pressures on the NHS at this time, you know, there was more and more when people were out of pain and functioning again and back on their feet, we needed to discharge them. But you would see the same old faces come back through the revolving door within months. And I was starting to see that I wanted to work in a different way. So I sought mentorship, and I was very lucky to find and be mentored by two amazing Canadian physios, Diane Lee and Dr. Linda Joy, or LJ Lee, who I think were pioneers in the whole person approach and the biopsychosocial approach, which was a phrase that wasn't coined at the time. And I really learned to listen to people far more deeply, which is very therapeutic in itself, but also listen and feel and assist them with my hands, and to use these skills and integrate with a really detailed patient history to really identify their drivers, if you like, of what was driving their symptoms, be that a region of the body, something emotionally or behaviorally contextual. So I was no longer just interested in the tissue that had an issue. Let me give an example with this. So imagine someone breaks their rib. So that's a skeletal issue. They brace it because it's very painful with the muscles around the fracture. And then maybe they breathe shallow, again, to minimize pain. So these are adaptive behaviors. And you can see from this badly drawn adaptation from the mature organism model, which was put forward by the late, great Louis Gifford, who was a fellow Cornish man and physio before his time with this kind of way of thinking. And he put forward that we receive all the information from our environment and the threat it poses to us and the context it poses to us, and our tissues, be those pain receptors, stretch receptors, pressure receptors, and all this information goes up to our higher centers, where through the lens of what's going on for us, our history, our stress state, our belief, our knowledge, body image, etc., we adapt and put an effort and output into our behavior as a response to what's happened. And whilst adaptation, like holding your breath or breathing more shallowly and bracing your muscles, is really appropriate initially, these adaptations can become maladaptive over time and may cause us to move and live in a different way in our bodies. For example, with your thorax being effectively stiffer, it has less of a rotational counter-rotation with our pelvis when we walk. Over time, maybe throw in a bit of stress from some home situation, some monetary trouble, some tensing in the shoulders, some poorer breathing patterns, reduced sleep, and someone can seemingly present with insidious hip pain. But with a clinical reasoning model that I'd now learnt to adopt, I'd be able to trace this back to a braced thorax and get really amazing results for their hip joint pain. Of course, this would progress into trusting their hip joint and being strong through it, but with a mobile thorax as well. So this is where I really honed my skills and started to fall in love with my profession again. So here you can see, by breaking the cycle, by dealing with the biggest threat, is where we make progress. Whether this is in a cycle of chronic pain or a cycle of chronic stress and deprivation, both end in us in this left-hand vicious circle. I won't read all these things out, but you can see if you can start anywhere on that circle, it becomes perpetual and very hard to get out of, as low mood, deconditioning, all spiral downhill. So to break that spiral, my job is to find that unique way in for that person through that assessment approach. And this also encompasses the pillars of lifestyle medicine, and start to explore options that have been lost and restore them and practice them and gain confidence in them to spiral out of this circle of behavior and belief. So my mentor, LJ Lee, created this visual representation of something like this, these circles of influence, where you've got the patient in the center with their meaningful activities and their strategies for performing them that may have become maladaptive. In the pink circle, you have the physiotherapy assessment findings and what we've deemed a driver. And in the blue circles, you have other systems in the body, and I'll let you read those for yourself. And the purple circle, you have more of these other influences, barriers and facilitators, like the beliefs of the patient, the therapist, the community, movement history, body awareness, context, nutrition, sleep. So this isn't a dynamic slide, but you can imagine if these circles could move, the places of greatest overlap start to present the greatest areas where we're going to get more bang for our buck, if you like, where we intervene. So this is how I started to view problems in my workplace. And if we apply this to the pillars of lifestyle medicine, and I've added planetary health in the left bottom corner there, I think of the pillars of lifestyle medicine as my sort of core that I will question about. And then I will zoom in and dive deep to use my Connect therapy assessment to get into their movement and injury history to find the drivers. And I will also zoom out. There we go. Zoom out to almost use a planetary report card relating to these pillars. So you can see pollution, the ocean, fresh water, land use, I mean, on a global scale, but even in terms of local ecology and transport issues, for example, isolation, access to healthy food and so on. So this is how I've come to be able to zoom in and zoom out of what's most influential in someone's or a community situation. So my next slide is one I pinched from Professor William Bird when he came to talk at the Kerno Lifestyle Medicine Conference for us in Cornwall last November. I found it really powerful, and I know lots of people were speaking about this all day because it really struck a chord. And it's got Sir Michael Marmot's quote, "What good does it do to treat people and send them back to the conditions that made them sick?" And as you can see, you could take the fish out of the water and give it good food and fresh pH balanced water, but you put it back in a tank like that and it's not long before it will be sick again. And the same goes for us as humans. So back to my journey. My spark of sustainability actually came from the creative sector and a client of mine at the time and friend, Matt Hocking. And he is an inspiring designer whose company Leap was the first B Corp in Cornwall and the first design B Corp in Europe. And you might be thinking like me, well, what's this got to do with healthcare? And he's an inspiring chap who taught me that 80% of environmental impact is decided at the design stage. Nothing is created by humans without impact. So as designers and creatives, they had a huge role to play in what the outcome was for our climate and the life we lead. The energy footprint of the internet is approaching 10% of the world's energy usage, and this is growing with more demand, and especially with the advent of AI and its huge energy costs. So me, on the brink of leaving the NHS and GP practice work completely to go full-time private, I decided that my clinic choices and even my profession could either harm or help the planet. And this B Corp thing he told me about provided a free business impact assessment to help guide your business decisions. And me not having a natural head for business, it seemed like the dots were connecting, and sustainability moved from being a personal interest to a professional necessity. And so I embarked on this journey of using the business impact assessment, using business as a force for good, as the B Corp world says. And you can see that quote from them on the right there. And in brief, I won't go into too much detail, but the business impact assessment has these 5 different areas that you can gather points in order to apply to become a B Corp, which I haven't as yet, even though I have the points, because my main goal is to use it as a robust business and wise choice tool, but I might at some point. So here is the practice I bought, and I'm insulating to make it super efficient. Where possible, I sourced local and sustainable materials. So I have recycled rubber flooring, a heat recovery system, infrared heating, really efficient, double glazing, locally fabricated gym equipment. And outside, I've got sustainable transport options, bike storage, seating, and EV charging. So this has been a labour of love, I must say, but I'm very proud of it. And then back into my choices of things I do. So I've changed my bank, my pension. This magazine on the top left corner here, Ethical Consumer, is in my waiting area. If you want to make good choices, that's a good publication to use. I've got local bamboo tissue and toilet roll from a company in Launceston, a company in St Agnes, create these Move Well exercise tools made out of sustainable cork. I'm doing group classes with the Community Hub and the local Climate Action Group, culminating in a garden exercise session. And some exciting projects in the middle here with Cornwall Greener Practice. I'm doing a project with Professor Claire Minshaw, who's a strength and conditioning researcher and lecturer, using her Joint Approach app. And we're taking people from a total knee waiting list and measuring their strength change and the carbon footprint of a total knee journey. Individually, I've done a swim with friends and raised money for Surfers Against Sewage. That was the Land's End to the Isles of Scilly. So exemplifying what's important to me, to my community. I'm a board member for Active Cornwall, who are evolving their offering to become a place-based service, looking at barriers in the community to getting active. And up at the top here, you can see my lifestyle medicine peers, our committee for organising the conference here. So I feel really well supported down here in Cornwall. And finally, my spiral of C words. So these are words and phrases that I've heard and learnt and, lived by through my journey so far. And I wanted to share them with you because reflecting on these keeps me going, keeps me motivated. So starting in the centre, getting curious. Everyone here is obviously already curious. We're on this World Earth Day presentation today. Look for causes that fit your skill set. Get uncomfortable with being uncomfortable. This is practicing out of the norm, I would say. Hopefully not for long, but you can get criticised and judged quite easily. So get comfortable with that. Have courage. Be creative. That's what gave me a new zest for my profession again. The working within my parameters and skill set, having the creativity with the people I work with is just a joy. Compassion for yourself, not only those that we help and support. Seeking collaboration is a really important one, and working cross-sector. As I mentioned, the creative sector has been a huge source of support and inspiration to me, and I'm lucky to be in a county where there's a lot of movement in this area by that sector. And being the change, walking the walk, following the practices that we recommend to people is creates a strong ripple effect and an appreciation, I think, and builds trust and integrity. Collect data, so not only our clinical outcome measures, but I'm learning to measure social impact and calculate carbon footprint, and to communicate that, be transparent with what we're doing and why we're doing it. And again, the creative sector can really be helpful in helping us tell these stories in a way that capture people's values and emotions so that they can connect the dots too. And see how this is all connected. And we want to make this common knowledge, the pillars of lifestyle medicine especially, and how they link to our planetary health. We want this not to be secret knowledge that members of the British Society of Lifestyle Medicine know about alone. We want this to just be every day. Everyone knows how to stay healthy and celebrate with your community and all the little achievements that you get done towards these goals are worth celebrating and acknowledging. And finally, a can-do attitude, because it's easy to be up for this when you hear a nice talk on it, but it's the doing that's really important. And there are loads of reasons not to do it. There are loads of obstacles and barriers, but it's the I'm going to do it anyway that that makes you take those bold next steps. So thank you very much. Any questions?
Thank you very much. That was really great. I really enjoyed that, Paula. And it's seeing the journey, and it is very much a journey, because as you say, when you see something inspirational or you think you should do something, you think, oh yeah, I do that. But actually all the tiny little steps that you have to go through to get one small thing done, particularly when there are so many sort of rules and regulations around everything. Looking at your studio there, it looks incredible, and I can only begin to imagine the minutiae of some of the details and the steps that you had to go through, but it looks amazing, and that's the way forward. And I love your C's. I love the curiosity and the collaboration and community. I think that's fantastic. And it really is using creativity and creative arts, and it's storytelling, isn't it? And it's watching, as Matt was mentioning in the chat, those 50 shades of green, and how you kind of step through them and you arrive to be this sort of a new professional, don't you, when you've come through, and before the era of the BSLM, and then showing the system and showing the patients that you walk the walk and that you're on a journey with them and we're all in it together. I think that's really important, because certainly we all become patients and we are all in it together. What I'm interested in is, what made you make that final decision by going from NHS to private? That's something I've thought about myself personally. I've not quite made the jump. I don't know if
it's
still
hard,
good.
I think. I
Yeah.
think maybe on a monthly basis, I would feel a strong pang, and then slowly it became a weekly basis, and then a daily basis of frustration, really. You with more and more pressures to, can you see people once or 3 times maximum? And you knew that you were scratching the surface, and yes, you could give them good advice, but you knew that their whole situation, or even their time to rehabilitate properly, just with my sort of glasses on, it wasn't enough, and it would be so much more cost effective to give them the time they need. And although my heart is in the NHS, and I advocate for free healthcare for all, I just couldn't be the practitioner I wanted to. So going forward, as my business improves, I've got lots of plans to subsidise and do cheap group treatment. I work with Help for Heroes, who get funded to see me, and hopefully my EV charger will provide some funding to subsidise groups so that I can offer cheaper, free solutions. I do free talks so that I still get to interact with the people who can't afford private healthcare, because it's exclusive, isn't it? So I've got different tiers. My one-to-one is kind of my main sort of money making part of the business, and I love that. That's where I really get a lot of satisfaction and can work with people who've maybe been around the houses. But the group and community work just is another passion, and so I feel really lucky that I get to do both, really.
It's lovely. It's that circular economy, isn't it? Going back to the donut economics, isn't it? And keeping it moving. And actually, that's a very good argument for making the jump, is make the jump, get established, and then start feeding back into the system. So it's a win-win situation.
And I think if your career has been in the NHS, it's very hard to sort of ask for money and payment and to put a price on what you do, because we're not, and even the public, healthcare is free, and there's a bit, well, where, will I get my value for money? But what helped me with the sort of B Corp process is that it is a triple bottom line that you commit to legally. So it's profit, people, and planet. And if you're not profitable, your business isn't sustainable. So sustainability has to run through all of it, and that's really helped me with my mindset of, I'll offer really good value for money, but there is money. And yes. I will offer other services that don't cost so much or are free as well.
Because it is increasingly frustrating in the NHS, as you say, and I work in emergency care. You've got to get them in and out. It's all about the flow, stick a plaster on it, get it out the front door. And when you're really letting them down, and I do what somebody mentioned earlier on, it's the post-it prescriptions. Let me write down the name of a book, this website. Yes. This is what you really need. And it's coming in the NHS, but just not for you, not yet.
Yes.
but it looks fantastic, and we wish you all the best of luck with that. Certainly, I found
For our next speaker, can I just leap in and say that that C word spiral, sometimes if you mention a C word spiral, you've got a slight palpitation.
I thought it would catch me.
But I thought that was excellent, and I think that would again make a really good infographic for how people can learn and realize that they may only be at step 1, 2, 3, or 4 of that sustainability journey of recognizing lifestyle medicine and the overlap with planetary health, but actually here are some other practical things that you can do. So I'm not going to steal it from you, but I might ask to use your inspiration to create something that is a little bit a paragraph or a sentence description for each of the C's, so that other people can then make use of it, because I thought that was a really, really good visual graphic of, I think, what everybody's been talking about today, and that sometimes we don't always recognize that it's the collecting the dots, it's the connecting the data, or whatever it is, the bit that we're missing. And actually, I thought that was a really good way of saying you may do some of these things, but there may be some others that are really, really, really handy as well. How did you devise or design that? Was that something that you were inspired by somebody else, or
No, I discovered Canva in making this presentation, and because I am visual and need to think of things visually, like in circles, and the vicious circle is very much what I'm always trying to break, and that's sort of almost that Fibonacci spiral is the positive I'm trying to create. And I thought, well, what in nature has that? And the fern came to mind. So yeah, it evolved last week with Canva.
We're talking earlier on about favourite mathematicians of Fibonacci. That's definitely mine, because that's the natural cycle.
Oh, yes,
Well done for choosing that one.
Yeah, me too.
I don't think there are any other questions in the chat, unless anyone wants to pop on a last one. But it's just to remind everybody who's here that a link to the recording of today will be sent out to everyone if you have to jump off early. But I think I can probably go ahead and introduce you to our final speaker, Matt. Is that okay?
Please do.
So we're very grateful to have Dame Parveen Kumar this afternoon talking to us about the medical consequences of climate change.
Hello, my name is Parveen Kumar, and I'm going to talk about the medical consequences of climate change. Just to say that I'm ambassador to the UK Health Alliance for Climate Change, and also on the advisory board of BSLM. So what I'd like to talk to you about is really, first of all, set the scene about what's happening around the world with climate change, and then discuss a bit about the pandemics and then the diseases that we think will be coming towards us while the planet warms up. You already heard a little bit about climate change, so I won't hopefully overlap that. So we really live in a changing world with lots of health threats that we've already seen. The first one, of course, is the pandemic. I'll talk a little bit about that, and also about the long-term effects of COVID. Talk a little bit about the changing of diseases with climate change and pollution, a little bit about the population migration, gender health, and also mental health, which of course is the biggest problem in the world, and hopefully sadly will get worse with climate change. So the current challenges facing us are really several-fold. First of all, of course, we've got obesity and its comorbidity, particularly diabetes, as we're all getting fatter with poor lifestyle, really, and eating the wrong food. But I think you've heard about that already today. And also, we've got the threat of antimicrobial resistance, and I fear that we've taken our eyes off that as climate change is ensuing, and of course, particularly over the pandemic. But we need to go back to that and try and resist using the antibiotics unless that's really necessary. Then we've got climate change, displacement of refugees, and changing diseases, and this is really what I'd like to talk to you about today. So this is a map of the world, and in fact it's a map which is modelled on changes in cereal grain yields to 2050. But in fact it really mimics that of climate change. In other words, the red, and the redder it is the hotter you get, the green is less hot. And these are really the yields that are projected ahead. And for example, if you take India, just a 1 degree rise in temperature, in global temperature, will decrease the yield of wheat by 7 million, which will of course then go on to starvation. And particularly in Africa, the lower income countries, where if that crops fail, they'll get malnourished and then into starvation. And then, of course, you get the migrations of populations to try and find a situation where they can find food and raise a family. And on top of that, of course, you've got the problems with flood, storms and fire damage, which we've seen all around the world. We've had the fires in California and Siberia and Australia and all of the places. We've had floods recently in England. And of course the droughts, which could be all over the place, but also the severity of the drought, and particularly there's been one going on in Ethiopia recently, which I hope is going to try and get resolved. And then of course the climate sensitivity of pests and infectious diseases, which I'll be talking to you in a second. So just a word or two about pandemics and what they leave behind. In fact, they're going to increase in frequency. The first bad one we knew about was the Spanish flu in 1918, but subsequently we've had the Asian flu and the Hong Kong flu and several other pandemics ranging from viruses. And of course the morbidity and mortality is huge over large geographic areas, hence the word pandemic. And this in fact disrupts economic, social and political aspects of a country. Of course, with the outbreaks, we put in measures, and as we saw with our quarantine measure, this led to a lot of anger, violence, tension between the state and the citizens. And then, of course, the impact is always higher on the lower middle income countries. We've seen amazing changes in behavior with fear, aversion to workplaces, which I think still is going on. But in terms of mental health, this has been quite major, with anxiety, depression, and also loneliness of having to not be able to go out and meet other people. But obviously Zoom became quite a big thing over the lockdown. And of course with children, their education has been disrupted, but also their interaction, which they learn by interactions with other people, and their communication skills will be limited. And of course, post-COVID, we get the long COVID effects. If COVID goes on for more than 2 months, or you end up with fatigue and symptoms, you can call that long COVID. But on top of that, you have all the anxiety, the fatigue, and feeling unwell. And many people have not been able to go back to work because of it. So this really shows you the various things that I've chosen here, really to show you the consequences of climate change, floods, fires, air pollution, deforestation, and then a warming planet. So let's just take them in turn. If we take the floods first. Floods, of course, if you can imagine, clean water and dirty water are going to mix, as you can see in this particular flood situation. So many of the consequences of medical consequences, of course, water related, cholera, enteric fevers and so on, amoeba. But it's not only just these and these worms, etc., but it's also malaria and dengue due to vector distribution and increase in the vector range. And I'll talk a bit about that. And then going down to air pollution, and this is obviously from burning biomass, forest fires, as you can see here. And of course this leads to people with asthma have problems breathing. It can lead to chronic bronchitis and cardiovascular problems. And then going on to deforestation, the Amazon forest has been a major carbon absorber, but sadly with the increase in deforestation, it's now become a carbon emitter. And not only that, but as you take the forests away in order to perhaps cultivate them or grow them, grow cereals, etc., but also housing, the animals lose their habitat and therefore stray into human habitats, and that's where you get the zoonoses, diseases from animals, which is tragic. And then lastly, we get the warming planet, and with that, populations are migrating, and with migration populations, you get a lot of harm. Usually, sadly, women and children are the people most affected from rape and sex trafficking, and also taking children for sex as well. And then, of course, the major problem is mental health, which is just made worse, both with pandemics, but also the warming climate. So what pathogens are sensitive to climate? Well, sadly, all of them are, including fungi, which I haven't included here. But let's just take the viruses first and see what they can do. I mean, why are they a greater danger for climate change? Well, let me take an example. Let's take dengue. And as you know, that's a flavivirus, and it's transmitted by a mosquito called Aedes aegypti, along with a couple of others. But these mosquitoes feed by day as opposed to malaria, which is by night. And they also, like malaria, breed in still waters, stagnant waters in urban areas. Now, with the temperature rise, what happens is the viral incubation is shortened, or the time for the viral incubation is shortened, and therefore you get a shorter breeding cycle. So the whole cycle of virus productions is increased. So that leads to more numbers of viruses, and obviously then increased frequency with mosquito feeding, and there's a more efficient transmission to humans. So the whole thing is going enormously rapidly. And this is true of malaria as well. If I've got here a life cycle of malaria, so the Anopheles mosquito bites the skin, goes into the blood, it circulates around the blood, and then out into the liver, where the malarial parasites replicate, and merozytes are produced, which are put in, which go into red blood cells. These then rupture and go around the circulation. Along comes a mosquito, bites, will take the infected blood, and then go on to another poor culprit and bite them. And here again, I've got a picture which I took in Africa somewhere with stagnant water. There've been temperatures, so there's been obviously rain, the temperature is very hot and humid, and these are ideal for the mosquitoes to grow, to develop. So looking at malaria, about 260 million cases of malaria in 2023, and this was the WHO report in 2024, last year, and shows an increase in cases of malaria year by year, and over 600,000 deaths. And many people are infected, indeed, also travellers. And so this huge increase in malaria, and we have a vaccine, but of course we haven't vaccinated the population. But with the increasing temperature, we're going to get more malarial Anopheles vectors, with a higher temperature, the rainfalls and so on. So this is going to be a major problem around the world. And in fact, it's not inconceivable that we may get endemic malaria back in Britain again, the way things are going. Excuse me. And then going on to another system, let's talk about infectious gastroenteritis. Again, obviously, the symptoms are those about vomiting, diarrhea, abdominal cramps or pain. And all the pathogens that I said, again, with gastroenteritis are sensitive to climate. So if you take the viruses again, these would be waterborne. And we saw the picture of the floods. And here you can see there's norovirus, hepatitis A and E. These two are fecal-oral, as is this one, and this is by personal. So in fact, in enclosed areas, this norovirus can spread very rapidly. And I met a ex-student of mine, in fact, who was the medical officer in one of the big ships, and they had a norovirus epidemic in the ship. and he and his team really were rushing around from cabin to cabin, trying to help the people who were obviously in bed. And then, of course, you've got other diseases. You've got the poxes, the myxomas here, and the mpox, spread again by person to person. But these two really are vector-borne again. Dengue, malaria, which I just discussed, and polio as well, is also through infected entry. And going on then to bacteria, all these I'm sure you will have heard of. These two are more gained in what we used to call the tropics, but they're all over the world. E. coli is a ghastly one with not only traveller's diarrhea, but gives you very bad dysentery as well, and Campylobacter. So let's just take an example here of cholera. And I don't know whether you've ever seen a cholera bed, but there's a ward with cholera beds. And as you can see, there's a hole at the bottom here, sorry, on the bed here, where the bottom is, you put your bottom, and really you die of cholera due to dehydration, because you literally lose all your fluids in your bowels, stools, watery stools, and they are collected in the can you see these bowls underneath these holes. And of course it's all about rehydration. As you can see, several bags of fluid for one patient, trying to make them recover. Again, contaminated food or water, over 1.34 million cases annually, with again a lot of deaths. And this again, as I said, is just torrential diarrhea with dehydration, and with high climatic temperatures, this is going to again lead to faster bacterial replication, particularly with low precipitation for some reason. But the WHO has got this on the sides, and they're trying to have a campaign of ending cholera. And the global roadmap to 2030 has a target of reducing cholera deaths by 90%. And of course 2030 is just 5 years ahead, so it's not much time to do that in. And then respiratory problems. WHO says pollution causes 7 million premature deaths worldwide, and this is both with air pollution, but also in Africa and the huts, and in India and all the Asian countries, they have fires inside their huts, and this actually has a problem because the ventilation is poor, so they get the double whammy of their hut as well as outside. So it's poor urban air quality, and these are the sort of gases that you will see: carbon dioxide, sulfur oxides, and some nitrogens and so on. But methane is particularly bad, as something like 80-90% times the problem that methane has on CO2 in the atmosphere. And then you've got the chlorofluorocarbons and all these other metals which cause pollutions. And then this, of course, leads to exacerbation of asthma, chronic bronchitis, cancer, and so on, and an increased risk of pneumonia. And there are good data suggesting that unborn fetuses is also affected. And the way this all happens is oxidative stress and damage cause inflammation, excess mucus, and then narrowing of the bronchi, and you get the asthma and the chronic bronchitis and wheezing, obviously, as the symptom. So overall, we're very much dependent on countries worldwide, but also the countries next door to us. And there's been an international collaboration on health and climate change with both WHO and Lancet countdowns. And they're looking into the extreme weather, air pollution, infectious disease, malnutrition, and migration displacement to see how we can somehow stop this happening by measures locally. And of course, we also have the increased risk of cardiovascular diseases and renal disease and other ones that I haven't discussed today. Now this just shows in 2019 air pollution was responsible for 11.8% of deaths. And the disability adjusted life years, DALY, is really a good measure of how bad the disease is, and the extent of the disease as well. And of course, high temperatures per se have caused death of people who are vulnerable, but also the very elderly and the very young have a huge death rate. So in summary, I've discussed the various viruses, bacteria, fungi, vectors that cause problems. This will increase with a hotter climate and will have a significant impact on the diseases, or indeed the re-emergence of diseases, particularly what we used to call the old tropical diseases, which we thought we had a handle of. There's mainly communicable diseases, but clearly they're going to re-emerge. They have an impact on lifestyle, and they'll have an impact on the local international economy. And of course that leads to a huge financial burden, particularly again in the low middle income countries, which really produce less carbon than the rest of us in the Western countries. But medical treatment, trying to get some medical treatment, food and loss of manpower, really costs them a lot, and it's estimated that over 10% of a monthly family income would be used for one person being infected, let alone the others. So this is a major socio-economic impact that climate change is going to have, and somehow we need to put measures to try and improve these trends in diseases. I just want to leave you with this rather sobering picture, and this was really taken during the Spanish flu pandemic in 1918. The word Spanish is really a misnomer. It was just a person who was Spanish who got it in America, and 25% of the world population were affected, with 20 to 50 million deaths, which is really quite colossal. And of course this happened just after the First World War, when people were malnourished, and therefore their immunity was down. They're much more liable to catch flu. As you know, we just had one recently with COVID-19, where the deaths were, reported deaths were some 6 to 7 million, but probably a lot more than that. So thank you very much indeed for listening, and I'm very happy to take questions. Thank you.
That was absolutely fantastic. Really appreciate. I think Dame Parveen is available with us at the moment, and for those of you who haven't met or heard her speak before, certainly for medics amongst us, those who've been to medical school, she was the co-founder and co-editor of the textbook Kumar and Clark's Clinical Medicine, and I think that's probably had more of an impact on my life than any other book ever. And I suspect that most medics feel exactly the same, that we could not have done without it. I'm going to ask a question for Dame Parveen. Please, anybody can put questions in the Q&A. On World Earth Day started because it was a grassroots action-based coming together of people. So my question to Dame Parveen Kumar is going to be, what action would you take? Would you suggest that we as observers or as participants would or could take? And one of the reasons for this is that at the very beginning, when we started today, we asked for each person to make a pledge to do one thing a bit differently, a bit greener, whether that be linking lifestyle medicine and planetary health and changing our behaviours as a result. And so really this is a question around what pledge or what action would each of us take, and if Dame Kumar is available, what she would use to inspire us. And just whilst we wait for Dame Kumar to appear, I just want to say thank you to all of our speakers today, because it really has been a very wide breadth of people being able to talk from different perspectives about the practical things that we can do, such as Terry Kemple talking about the Green Impact for Health Toolkit, some things that we can all do, whether we are medics or other, in our consultations, how we can become do listen far more. And we've heard the word listening coming up several times. Whether it be things that we can do in our personal life or our professional life, whether it be thinking about the natural living world, and whether it be forests, whether it be smaller scale in terms of gardening, whether it be taking the plants that we grow and eating more of them, so plant-based eating, whether it be the impacts of a changing climate and the pollution of our air, our land, our soils, our water, and how that sort of links energy and food and climate all together. Whether it be the individual journeys that we go on. So Paula talking about her journey. We don't start as 100% sustainable. We don't start as deep green people. It's a journey to get there, and it's doing those things that are a bit greener. So it's really a thanks to all of those who are who have been talking today, who've shared their wisdom, and I know that the recordings will be made available. It's to all of those who've attended. It's to all of those who are watching on Catch Up. This is the opportunity to have some great conversations, meet some great people, and learn some great things. But the important thing for me is the doing. What are we going to do as a result of what we've learned? There's no point in just learning things just to learn it. It's about doing. It's about that behaviour change. Is Dame Kumar available for questions? Good afternoon, Dame Kumar. How are you today?
I'm fine. I'm so sorry. I just logged on with whatever I had.
Do not apologise at all. I hope that you heard that we were singing your virtues on the other link. If not, we can sing them again for you.
No, don't sing them, and luckily I missed them, so that's fine by me.
So there was a couple of questions. Firstly, from your talk, one of the things that World Earth Day has done is it's a grassroots movement about people doing things to make a difference. Is there anything that you would recommend either you do or that other people do to try and address some of the problems that we are facing today?
Yeah. Well, thank you for that question. It's actually very perceptive of what's going on at the moment. I think we can all do what we want to do, and I think we've had quite a lot of that today in this excellent conference. I really enjoyed it. I think what we need to do is to get together like-minded people and somehow press governments, both our own and around the world. And I think certainly Mr. Trump has not done us any good at all by putting climate change out of reach for a lot of people. And the people, of course, who are producing most of the carbon footprint are America and China, and indeed India. And it seems to me they're dictators where we can't really get much edge in. But I'm sure, in answer to your question, yes, I'll do lots, and I try and do lots to sort of reduce my carbon footprint, go onto a plant-based diet and so on. But we do need to really pressurize governments if we're going to get anywhere.
I think one of the things that was in the news today, probably as a result of World Earth Day, is that 89% of people say that the climate is changing, that they are concerned and that they want to take action. And we sometimes forget that these are the silent majority, but it gets shouted down by a few, and we forget that actually there are people all around us every day, walking every street in every neighbourhood, who want to do something to make a difference, to make the world a better, a greener place. There's two other questions. One is, should we have more training in medical school in what was euphemistically called tropical medicine, but should now probably be called domestic medicine? When we start getting malaria endemic to North Scotland, we kind of know that we're really in trouble. So whether this is now domestic medicine rather than tropical.
Yeah, you're absolutely right. I think it needs to be in every curriculum in all medical. I think not in medical schools. I think in all students. It's interesting, isn't it, that it was the medical students that really pushed us into having something on climate change in the curriculum, and healthy living is actually way down on that list as well. And I remember it took me over 20 years to get that on the curriculum. When they did get it, it was the medical students who actually led it and got it on curricula. And they now have a very good collaboration with all medical schools with their planetary health record, which I think they now take seriously and hold their medical schools to account to actually follow that. So it's the young that are really telling us to change.
I will put a link to the scorecard for medical schools, and I think that Maria's got a question as well.
Oh yes, having been involved with various different organisations over the years, I was just wondering what your opinion is really on doctors taking more direct action, basically against the government and speaking out with a louder voice than we have been doing. Because I certainly know where I work, even talking about climate change with patients is really not commonplace, and it's not particularly encouraged. Whereas I think I should be talking about it all the time with everybody because it's so important. And I just wondered where you sat on that.
No, you're absolutely right. I mean, we've been talking today really to people who already accepted climate change as being a problem. Yes, no, I think if doctors can get together, and I remember one previous Minister of Health saying it was the 2012, the disastrous act they had for Healthcare Act. And he said, if you'd all got together and came to me with one voice, I would have been a stupid person to have refused you. And I said, well, actually, we did, and you did refuse us. So I think it's a question of getting together and having a major part. And I think that's what UK Health Alliance for Climate Change has been doing. I think it's made a huge impact in the last few years, having started with just a small voice. And I think, I mean, I'm a late comer to the lifestyle medicine, but certainly we can do that ourselves. But most of it has to be the will of the government, I'm afraid, whatever we say, because they've got the power to change things.
I suppose I've always seen it as a top-down, bottom-up approach because it's the power of the people, and it's supply and demand. And if we demand something, they might supply it if we're lucky.
Yeah, but then, as you say, it's the power of the people. So you've got to get the people together to have a bigger
You've got
part.
to exactly motivate the people. And in the NHS, where we have 50 million conversations every year with our population, we seem like a really good place to do this.
Yeah, no, absolutely.
I popped a link into the chat. About 89% of people across the globe want us to be doing more. So I think that we have got the silent majority on our side, and it's about how we get their voices heard as well. I think that we are due to close in about 60 seconds time, so I'm going to say a huge thanks to Dame Kumar for closing our event today. I think that I can see from all of the messages that we've had that people have really enjoyed this. I hope that people go away and absolutely find that they can make a difference in their personal life, their professional life, and both at population and community level and at a planetary level. Just as a reminder, the SurveyMonkey link is in the chat for people to let the organisers know how people found it. I hope to see as many people as possible at the annual conference in Brighton in the autumn. I know that the recordings will be put together over the next week or so, and people will be able to have access to them. So hopefully we are dead on time. How often does that happen? And we will be finishing and closing. You are now released.